All right, the Health and Human Services Finance Committee will come back into order. We have House File 118. Representative Howe is back at the testifier table. Welcome back, Representative Howe. We will pick up where we left off earlier in the day with testifiers. We knew that we were coming back this evening, and I did not realize that we would be coming back this late. It was dependent on our caucus, which lasted longer than I anticipated. So I just want to apologize to everybody here who had to wait. It was not my intention or knowledge that it would be this late, and I do apologize for inconveniencing people with that. I would like to pick up with testifiers Sarah Nelson and Deborah Huskins. Either of them. Okay. Welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Thank you, Mr. Chair and members. My name is Deborah Huskins. I'm with Hennepin County. I'm a director in the Human Services Department there and responsible for the public assistance eligibility programs. Hennepin County opposes House File 118. Rather than simplifying and aligning eligibility requirements, this bill would unsimplify current statutes. The bill is a step backwards in the bipartisan work that this legislature and others did several years ago to streamline and align public assistance programs. As you know, taxpayers pay an inordinate amount of money for the administration of public assistance programs. Having different asset limits for different programs means the workers need to keep different program requirements in mind all the time to make sure the rules are followed accurately. This becomes increasingly difficult. The computer system itself needs to be more complex. People who are seeking help need to comply with different tests for different needs, and they become more and more confused, and that adds to an already complicated experience. The process, therefore, is more error-prone and more errors are made. Also, as you know, the computer systems that the county workers use to administer these programs are aging and they need to be replaced. If we don't simplify and align the programs and the tests and the processes ahead of time, we will be programming complexity into systems into the future, which is going to be more and more expensive to develop and to maintain. Regardless of changes that are being proposed currently at the federal level, we need a more simplified approach that allows us to be efficient and accurate in providing benefits to the people who are entitled to them. It will be key that we try to simplify and streamline and align as much as we can into the future so that people can get the right level of support that the law requires. Thank you, Mr. Chair and members, and if there are any questions, I'll be happy to try to answer them.
Thank you for your testimony, Ms. Huskins. Are there questions for the testifier? Representative Pinto.
Thank you, Mr. Chair. And I just wonder from the testifier if she has any sense or if anybody has figured this out as to how much more this would cost the counties to do this have this additional administrative burden and all of it.
Ms. Huskins.
Mr. Chair and Representative Pinto, we have not done the cost analysis yet in Hennepin County, but we are prepared to work with MMB on a local impact analysis as needed. Thank you.
I guess, Mr. Chair, maybe just a quick follow-up. But it sounds like clearly it will be positive in the sense that there will be higher costs imposed on the counties. They'll have to either cut something else or increase property taxes to make up whatever that cost is when you figure it out.
Mr. Chair and Representative Pinto, of course it will take longer. If there currently is not an asset test and then there is an asset test, the workers will then have to start looking at all the assets, determining how they meet the test, getting verification, questioning if the verification isn't clarified. It will take more time and therefore more resources.
All right, further questions? All right, seeing none. Thank you for your testimony, Ms. Huskins. I also do want to direct members, Ms. Nelson, who was not able to come back and testify, did submit written testimony for the committee that is with members and would be on the record. So I want to acknowledge that as well. With that, is there anyone else in the audience who'd like to testify on House File 118? All right, seeing none, we'll close off the public testimony portion to House File 118 and open it up to member comments and questions. Representative Fisher.
Thank you, Mr. Chair. Yeah, I was kind of struggling with this a little bit earlier as I was speaking, and one of the things that has come to my mind as I've reflected on this for the last couple of hours is the situation that probably will not be too dissimilar from this in the future is comparing to what we heard last year from TEFRA folks who were in here, who had children that were receiving different medical services, but they were having to become very poor in the process. They were having to be at risk of losing their homes, et cetera, and all because there was an asset limit that was put on there that was too low, and we created a problem out there. I take a look at the same thing as a potential of creating another problem. At what point down the road, when we have the next Great Recession, you've got a family that has had a good job, they've got their home, and all of a sudden they lose their job. They don't have much in savings because they've got some kids in college or in school, and all they've got is the asset of their house. You know, all of a sudden have we created another problem that's going to come back to haunt us down the road that we regret that we created. In addition to the additional barriers that it may create for the poor. I just want us to keep that in mind because I know last year we were dealing with it on the TEFRA issue where we had the asset limit, and we're wondering how we could deal with that. Are we setting up ourselves for the same problem here?
Further discussion, Representative Pinto.
Thank you, Mr. Chair. And I just want to emphasize that even in we've had some limited testimony just because of the time constraints, but what we've had, the information we've received is that if this bill goes through, thousands and thousands of very low income or Minnesotans with who I think many of us would agree do deserve food assistance and really should have it, unlike somebody who's a millionaire, like the person who testified. Thousands and thousands of those people will lose the opportunity to have food and have that support. We will have increased cost to counties. We don't know the exact amount at this point, but we know it's going to increase the cost. Increased cost to the state, we don't know that as of yet, but fiscal note is coming along. And on the flip side, the benefit is we know one person who has apparently stopped receiving the benefit will continue to not receiving it, and we have no evidence that anyone else who we all would agree should not be receiving it, such as somebody who has $1 million in assets, that person, no one else would be prohibited from having it that we're aware of any kind of problem. So on the one side of the ledger, we've heard evidence and testimony that this would cause huge problems and complexity for people who we all know are desperate for a really basic need, which is food. And we still, despite my colleagues bringing this up at the very beginning, have not heard evidence to the contrary. This is in fact a problem other than the very person who brought it to us in the first place. So I'm strongly opposed to the bill, as I know my colleagues are as well, and I hope that we can vote it down at this point and move on to other things. So thank you, Mr. Chair.
Thank you, Representative Pinto. Other member questions, comments? All right, seeing none, final word, Representative Howe.
Thank you, Mr. Chair and members. You know, this probably needs some refinement, and I've been open from that from the day I dropped this early in last year. And I met with a few people, and we had the discussion on maybe some proposed changes, and they were supposed to come back with some numbers, and we were supposed to come back with some dates, some refinements, and no one came forth with anything. So I am still open to some changes, and if someone can help me figure out a way to modify the bill, amend the bill, to make this a simpler process, to keep the folks that don't need the assistance, that doesn't deserve, that wasn't intended to go to. That's what the bill is for. This bill is not intended to kick anybody off, prevent anybody that needs help from getting their help. All this is designed to do is keep folks with large assets from getting services that they don't deserve, and it wasn't intended for. That's all this was intended to do. And I'm not looking to kick anyone off that deserves it. I think this, what we're trying to do is prevent people and put the guidelines and the structures in place to prevent those who it wasn't designed for from getting these assets. That's what we're trying to do, and I thank you for your time and your indulgence into hearing the testimony, and I look for your support.
All right.
Thank you, Representative Howe. And, oh, I'm sorry. Go ahead.
Thank you, Mr. Chair. I'm sorry, I know he was closing, but your Representative Howe, your testimony did just raise for me one question. You know, your intention is not to result in anybody who's deserving to lose access to food, and that you're looking for advice. And it seems to me we've had testimony in the committee that the bill as it's drafted right now would result in people who are deserving losing access to food. So as the author of the bill, while I know you're looking for advice, I'm wondering where your commitment is to refining the bill to make sure that the result is what you're trying to do and not inadvertently resulting in the thing you say you don't want, which is people who are deserving of this benefit losing it. So I'm wondering if you have just a little bit of feedback from me as the author of the bill about your intention of making sure that the consequence of the language as it's drafted right now and the testimony that is suggested that it would actually hurt people that you don't want to hurt. What is your plan about that?
Representative Howe.
My door has always been open to take some, for feedback and for guidance on how to make this a better bill. I have been open to that. Everybody that's walked in and talked to me, that's been they said it was too low. I said, offer a number. I'm good with that. It's too complicated. Help me find a solution to make it simpler. I think my testifier said, let's just audit it like we audit tax returns. One every so many. So you set up the guidelines. We are here, and I think it's our responsibility to set the structure and the guidelines up so people don't abuse it. And I do believe, and I believe I had someone here that's shown that it is open for abuse. And all we need to do, and what I was trying to do, was put things in place to prevent people from being able to abuse the system. That's all we're trying to do.
And Mr. Chair, thank you. And I am hearing I'm hearing what you have to say. And each of us are elected with an election certificate, and we each have a responsibility with that. And we've had testimony that as the bill is drafted right now, it could cause harm. And so I'm wondering if there's not a fix, if someone doesn't come through your door with a solution that solves that, would you persist in moving the bill forward?
Representative Howe.
Thank you, Mr. Chair. And I will probably make amendments on my own to try and make it a better bill, to try and not target the folks that, from the input that I've had. But I've reached out. I'm open. And if no one provides me for anything, I will just modify and amend the bill as I believe I've heard, and we'll move forward with that.
All right. I will move that House File 118, renew my motion that it be re-referred to the Committee on Health and Human Services Reform. All those in favor, please say aye. Aye. Those opposed, no.
No.
The motion prevails. Thank you, Representative Howe. The bill is re-referred. No. No. Members, next on the agenda, House File 2741, Representative Quam's bill will be taken off the agenda for this evening. We will be moving on to House File 3291, Anselmo.
Mr. Chair?
Representative Murphy.
As Representative Albright is coming up, I was just wondering, because we got started a little bit late, and we've got some bills that have a lot of testifiers. I'm wondering if you might be considering moving some of this around to take those bills up.
we've been trying to manage who's here and the testifiers, and I know that folks have been checking in with the staff, so we're doing the best we can.
Thank you, Mr. Chair.
All right, Representative Anselmo has brought purple treats from the purple land of Edina. All right. Representative Anselmo, welcome to the committee. I will move House File 3291 will be laid over. The bill is before us. There is no amendment. Representative Anselmo, to your bill.
Thank you, Chair and Committee. And these are the last of my freshman treats. I saved the best for last. Enjoy them. Maybe use a little sweetness here, a little cake from Edina. I know that's a big surprise. I'm here to introduce House File 3291, a smoking cessation bill. I'd like to thank all of my co-authors, Republicans and Democrats, in-state, out-state, especially the chair who signed on to this bill, which is appreciated. And helped pass this last year out of committee, and I'm hoping we'll do that again. I also want to make sure that everyone said this is the smoking cessation bill. We're looking to find a funding mechanism to keep the smoking cessation services going when they're due to quit. I'm going to try to keep this brief and pass this off to Molly from Clearways to give some testimony, and I'll give you some closing comments. Thank you.
Thank you. Welcome to the committee, and please proceed with your testimony.
Thank you, Mr. Chair and Committee. I'm Molly Moylanen with Clearway, Minnesota, and I also co-chair Minnesotans for a Smoke-Free Generation. We're a statewide coalition of 60 partners dedicated to reducing the harm tobacco causes the people of Minnesota. Our coalition partners include the American Cancer Society, the Heart Association, the Lung Association, the Indigenous Peoples Task Force, the Mayo Clinic, the African American Leadership Forum, the St. Paul Area Chamber of Commerce, and the Minnesota Medical Association. I'd like to thank Representative Anselmo for championing this proposal and thank many of you for co-authoring the bill as well. Clearway Minnesota is an independent nonprofit organization funded with 3% of Minnesota's tobacco settlement. Our mission is to enhance life in Minnesota by reducing tobacco use and exposure to secondhand smoke through research, action, and collaboration. We were established as a limited life organization, and we will sunset by 2022. Since 2001, we have operated Quit Plan services. These are effective, science-based programs that give Minnesota tobacco users free tools to quit. Quit Plan services includes phone counseling, medications, emails, text messaging, and other self-help materials. More than 170,000 Minnesotans have signed up to receive help from Quit Plan. In addition to those who sign up, Quit Plan services reaches hundreds of thousands of people every year through its website and over the phone. In 2017 alone, more than 225,000 people visited the Quit Plan Services website or called our phone line, and Quit Plan will end in March of 2020. This bill allocates funds to ensure Minnesota's commitment to tobacco cessation remains after Quit Plan ends. All other states do provide cessation services. If the legislature does not act now, Minnesota will become the only state not to provide these needed services. As Representative Anselmo has said a number of times, smoking remains the #1 cause of preventable death and disease in Minnesota. Smoking takes a tremendous toll on lives and money in Minnesota, around our country, and around the world. Over the last 20 years, Minnesota has seen great progress in reducing youth and adult smoking, but we know nearly 600,000 Minnesotans still smoke, and the majority do want to quit. The good news is helping people quit is one of the most cost-effective health services we can provide. Research shows that the cost of smoking cessation programs can be fully offset in 3 years. Now, planning funds are needed now, and full funding would start in fiscal year 21. This timing would be ideal to avoid gaps in coverage. Many of you have heard me talk about this as a track relay. As one person starts running, the other has to catch up to pass the baton. And so this is what would be needed to make this a smooth transition from Quit Plan to the new program. Quit Plan services will stop accepting new participants in March of 2020. The new program should start accepting individuals at that time to ensure no gaps. It's been our honor to help Minnesotans quit tobacco use through Quit Plan services, and it's in all of Minnesotans' best interest to continue this work because it will save lives and money. Thank you.
Thank you for your testimony. Is there anyone else in the audience who'd like to testify on this bill? All right, seeing none, we will close off the testimony session and member questions. Are there questions for the testifier, Representative Anselmo? I had one. Just the contours of what you can do and what you can't do was set up with the settlement of the tobacco settlement, and that's what kind of set up the charter of the foundation and for your mission and what you're to do. However, moving forward, I would imagine that those constraints would no longer be connected to those dollars or any other dollars. Is that correct?
Mr. Chair, could you just clarify your question? Are you talking about the dollars that are funding Clearway Minnesota or ongoing payments?
The new money that's attached to this that's being requested from the state of Minnesota.
Mr. Chair, the new money that would fund these services would not be under the constraints of the original tobacco settlement that was completed in 1999.
All right, thank you. Are there other questions? All right, seeing no other questions, final word, Representative Anselmo.
Thank you, Mr. Chair and committee. As you know, this is an important issue for me and for a number of people in this room and throughout our state. This is an awful addiction that affects families, friends, and costs our state $3 billion a year. The cost of smoking and hard cost, another $4 billion in lost productivity, and most importantly, lost lives. I'm hoping that we'll pass this and carry this on to the omnibus bill and push this over the finish line with your help. Thank you, sir.
Thank you, Representative Anselmo, and thank you to the testifier. And with that, House File 3291 is laid over. Thank you. All right, next up, we'll have House File 3859, Representative Lee.
Oh my God, this is awesome.
Oh my gosh. Wow. More vegetables disguised as donuts. All right. Is it fruit?
All right, Representative Lee, welcome to the committee. I will move House File 3859 be laid over. We have the bill before us. I see no amendments. Representative Lee to House File 3859.
Thank you, Mr. Chair and members, for this opportunity to present House File 3859, which is asking for $10,000 appropriation to the TAP in St. Paul to support mental health and disability communities through spoken art, community supports, and community engagement. Our neighbors with disability labels are oftentimes discriminated against, and the TAP wants to help change that. Too often, our friends are set apart, quarantined, and managed. And we believe everyone has a right to socialize, express themselves, and meet new friends. And the TAP hosts social gatherings such as parties, events, clubs for everyone, specifically to our friends with varying disability, to connect them to natural community relationship in a fun and welcoming environment. And to that, Mr. Chair, I'd like to hand it over to Mr. Daniel Cashman and two of my testifiers.
Welcome to the committee. Please introduce yourself for the record and proceed with your testimony, sir. Just pull right up to the microphone. There
Thank you, Mr. Chair. My name is Daniel Cashman, and I'm the founder of the TAP. And we just have a couple of brief things to tell you today. The TAP believes that when you throw a community party or a social event and you invite the community to join in, our friends with varying disability labels will not be set apart, and they will advocate for themselves and live better, diminishing the need for continued and expensive system services. Has a party really made a difference for our friends with disability labels? The answer is yes. How do we know? We can ask them. You can ask Mike, a construction worker on the east side of St. Paul, trying desperately to battle his depression by writing poetry. 15 years in silence, he writes, turning away from society and shutting off. Then he comes to the tap, stands up on a microphone, and wows an appreciative crowd, and they beg for an encore. Then he starts his own spoken word club called the Urban Journal, and now he's considered one of the East Side's most prominent voices. He has appeared at Mounds Park Theater, East Side Freedom Library, and in June he will co-facilitate a performance stage at the Art in the Hollow Art Festival. Mike regularly now encourages others to express themselves. We can also ask Paul, and I have Paul with me, so I'm going to turn the microphone.
Welcome to the committee. Please introduce yourself and proceed, sir.
That was quick. My name is Paul Stambaum, and thank you for this time for me to be able to express my unwavering I'm so impressed with what TAP has done for my life. I'm a guy that for 17 years was basically locked behind my door of an apartment. And for part of that time, I actually moved into my closet. I'm sure if anybody knows how big an apartment closet is, it's not that big. And that's where I actually moved into my closet for a few years. And I was lucky enough to get fired from my ILS worker about 1.5 years ago, and was able to meet Dan, and he encouraged me to attend the TAP. And I did the first time, and when I did walk through those doors, sometimes you have a feeling, this is different. Something about this is different, and that's the feeling I had when I walked through those doors. I didn't stay as long as I thought I would, but I stayed and continued to go back, and now, this many years later, I'm working a full-time, well, not a full-time job, but I'm working a job for 1.5 years. I just can't say enough good things about this. This is an incredible community that these people have created. Watching people come through the doors, like I did that 1.5 years ago, and see these people blossom into wonderful people, and artists, poets, you name it. I'm gonna stop there, and I'm gonna read a poem that I wrote shortly after I kind of blossomed out of my. You can tell I'm nervous here. My voice is breaking.
You're doing a great job.
This is, considering where I was 1.5 years ago, and me being in front of this crowd right now and speaking in front of this is an absolute testament to what this thing has done for a lot of people. But I'm gonna read this for you, and hopefully you enjoy it. Tied up, bound, stuck downtown, upside down. I just can't come around to the fact I have to just sit down and think and try not to drink, simmer my thoughts, playing around with the plots that are my life inside my mind, so damn rough, a veritable roller coaster ride for so long, so dark, a mark on my soul, feeding the troll inside, and yet I still abide its idiocracy. Try to avoid the fallacy, that final drop. Wait, what's this? A light. A bird taking flight, almost dropping to the ground, but somehow new flight is found. The atmosphere is here. I'm inbound. Here I come. I'm found. Thank God I'm found.
Thank you, Paul. Well, I don't know if I have anything else to say after that. We could also ask a mother of a young lady who's wears an autistic label and was abused by a care provider about her experience with the TAP when she comes to celebrate and sing Leslie Gore's "You Don't Own Me." We can also ask the insurance salesman who's here with us tonight. He's over there. John has never had contact with anything in human services or people with labels. Well, it's not true anymore. John came to a TAP event and told us that it was his awakening. He must be telling the truth. John volunteers at nearly every TAP event. He designed our website, marketing, and promotional materials. He runs our karaoke, sound, lights, and advocates fiercely for us. Oh, and he's also our board chair. Thanks, John.
Thanks, John.
And lastly, me. I've been in human services for over 25 years. The last 20, I have owned and operated an adult foster care setting in East Side. In that time, I've witnessed the copious amounts of funding to provide basic supports, housing, and services. I also watched as these valued citizens were reduced to a service recipient. Seeing themselves as a project or a charitable obligation, their confidence was lost. They had no desire to self-advocate. The TAP is truly changing that. We're doing business differently, and it's working. And finally, we could ask our psychiatrist friend, Vicki, who succinctly summarized the TAP by saying, "This is amazing. It's some of the best therapy going." And then Becky's going to finish.
Welcome to the committee, Ms. Fisk. Please
Thank
introduce
you.
yourself.
Thank you. I'm going to close with a couple journal entries, short, but a couple journal entries that describe how I feel about the TAP and the changes that I'm seeing. We had a wonderful urban journal last night, a record 40-plus people crammed into our little coffee shop, a brilliant 17-year-old Native American rapper, a passionate Mother Earth poet, our resident poet Mike, a young black mother poet writing about her children, myself, a man with some deep mental illness issues, a beautiful nurse for sexual assault victims sang, a couple children performed, a local African-American comedian had us all in stitches, and a couple of our labeled friends spoke, danced, and sang their hearts out. Never have I experienced such diversity, and never have I felt such goodness and love and freedom as I did last night. And then this one. They change. They change from dancing, snacking, gaming, singing, reading their poetry, speaking their pain, and making friends. It happens because this is one place they are accepted among friends of all abilities. They get to be their freed up selves. There's no right way to dance or sing or write or even make friends. In the words of one of our valued autistic friends, everyone gets to be everybody. How often does that happen? How often do you and I get to do that? And what does it do to us? We sing, they clap. We joke, they laugh. We dance, they dance. We read, they cheer. My feelings celebrated. Not just received or tolerated, celebrated. For the first time in my imprisoned life, I am free, unplugged, and joyous. Nothing in the world like watching a line of friends throw back their heads and sing at the top of their lungs. Nothing in the world like hearing them support each other. Nothing in the world like hearing them say they want to start a spoken word club, an autism club, a video gaming club, a signing club, a wrestling club, or a recovery club.
Better Together Club.
And a Better Together club. Nothing in the world like seeing them go after it with unsurpassed passion. Nothing in the world like watching these same shy people start conversations, go on about coming to their club, move out of their group home to live on their own, give each other jobs, and get together with each other apart from the TAP. Nothing in the world like seeing them light up with the joy of finally speaking their pain and then shedding it. Nothing. This happens at the TAP, inside and out, almost daily. Changing lives is not quantifiable.
All right, thank you for your testimony. And,
Thank you, Mr. Chair.
That was Becky Fisk, event
Yes.
coordinator at Urban Journal, co-founder, correct?
That's right.
Thank you. All right, that's what we have for testifiers. Is there anyone else from the audience who'd like to testify on behalf of this bill? All right, seeing none, we will close the public testimony portion of the bill and open up to member questions. Members.
Any questions?
Representative Albright.
To the author or to anyone that testifies, thank you for presenting the bill. I'm just curious in terms of the name, the TAP, where did that come from?
The TAP stands for Tapping All Possibilities.
All right,
Thank you, Mr. Chair.
thank you. Representative Liebling.
Thank you, Mr. Chair, and I just want to thank the testifiers thank you, Representative Lee, for bringing this bill, and thank you for hanging around late so that we could hear from you. This is, very inspiring to hear your work and your journal entries and to hear about the great stuff that you're doing. And I certainly hope that we can get this funded. $10,000 to real people, that's a lot of money. In the state budget, it's kind of change under the couch cushions in the sense that, sometimes, I don't know if even in the Ways and Means Committee, sometimes, that's, I don't know if that even means that we have to really even hear it sometimes in Ways and Means. Is this going to Ways and Means, Mr. Chair, or is this being held laid over? It's being laid over, I assume.
This, Representative Liebling, this is being held over. I don't know what the last couple of years have been. With under Chair Holberg, de minimis was $40,000. I think with Chair Knobloch, it's about $13. It's 2,000. It's not $14. I'm sorry, Jim.
Okay, Mr. Chair, well, 2,000.
Yeah.
Okay, so, well, you're a little bit over that, but it certainly sounds like a great investment to me. Although, that actually does kind of bring up, I'm not really sure if we heard, what exactly the money would do. Could you just maybe give us
Representative, we were trying to be brief. We don't want to take too much time. We realized the late hour. But the appropriations will basically be to sustain future events. In the last year and a half, on a very shoestring budget, thanks to all of our volunteers, we've had 125 events, averaging an audience of anywhere from 30 to 150. So at these events, and we dance, sing, karaoke, party. It's just like any place any of us would go to hang out with friends and socialize. So the money would go directly for those events, and we kind of know how to stretch a dollar to make the greatest impact.
Well,
Thank you.
Thank you, Mr. Chair, and I hope that we can fund it. Thank you very much again
Thank you.
for being here.
Thank you.
Thank you,
Thank you so much for your time.
Thank you, Representative Liebling, and Representative Lee will give you the final word, but I will say that of the bills that do spend money, this is the smallest appropriation. So congratulations from one fiscal conservative to another.
Well, thank you, Mr. Chair
Number
and
one.
members, for this opportunity to present House File 3859, and appreciate the support. Thank you.
Thanks for coming to the Health and Human Services Committee, and once again, we apologize for making you stick around. We appreciate the treats as well. Thank you so much. And with that, I'll renew my motion that House File 3859 is laid over. Thank you, Representative Lee. Next up, we have House File 3975, Representative Loeffler. Representative Loeffler moves House File 3975 be laid over. We have the bill before us. Representative Loeffler, to your bill, we have one testifier
Yes.
and no amendments.
No amendments. Thank you, Mr. Chair and members. We have heard over the past few years about the growth in reports of child abuse and neglect, much of it related to alcohol and chemical dependency issues. It's been growing dramatically. And of course, many of those children are in a situation in which they need to be placed in alternative housing while their family members try and sort out the issues that are confronting them. And we haven't increased foster home rates, so it's not easy to get people to step forward to take care of someone else's children who are in trauma and distraught. And this is a small request for $75,000 to try some new approaches to recruiting. And with that, I'd like to turn it over to Jody Wentland. She's the Director of Human Services at Hennepin County.
Welcome to the committee. Please introduce yourself and proceed.
Mr. Chair, ladies and gentlemen of the committee, my name is Jody Wentland, and I'm the Human Services Director for Hennepin County. I'm here today to speak in support of House File 3975. As you know, Child Protective Services and foster care continue to be an area of growing need. In the last 3 years, Hennepin County has seen a 72% increase in out-of-home placements. In 2017, Hennepin County spent $42.8 million in out-of-home placements. While this is a significant cost to the county, more importantly, this has a significant impact to children and families. Hennepin County has implemented changes in the way we work with children who are at risk of maltreatment. Since spring of 2015, we've hired an additional 100 staff in Child Protective Services. We've implemented a 24/7 child protection response. And we've also invested a significant amount of county funding to move upstream in providing supports and services to families in crisis. In 2015, the county allocated $3.6 million to increase child protection staffing. In 2017, the Board of Commissioners approved $13 million to continue addressing increasing child protection caseloads and to begin to institute the child well-being practice model to focus on early identification, early intervention, and prevention efforts to reduce entry into child protective services and ultimately reduce the need for out-of-home placements. However, despite additional investments by both the state and the county to prevent maltreatment, we have seen the opioid crisis continuing to increase child protection numbers. Currently, 90% of child protection cases with infants involve parental drug abuse. There has been an 88% increase in children ages 0 to 5 removed from their homes where the primary reason for removal is parental drug use. Once in the child protection system, we're seeing the length of time children in protection drastically increase as parents are struggling with opioid addiction. These additional state resources allow Hennepin to work with our community to develop additional foster care placements. I want to emphasize that as we do the deep work to transform our system, we're uncovering some of the long-standing roots to disparities we are working to eliminate. We want to work smarter, not harder. To that end, we know how important it is to engage our community partners as there's a lack of culturally appropriate placements for children. This is becoming a greater issue due to the disparate impact of opioid crisis on communities of color. Our current system cannot support the growing demand. This grant allows for continued partnership across the state, the county, and the community to address the needs of our most vulnerable children by ensuring that there are quality, culturally appropriate placements for children when their families are in crisis. We have existing partnerships and providers of color that serve culturally diverse families. Funds from this bill would allow us to deepen the level of collaboration we have. Our systems would pull on their expertise, their connections in the community, and their culturally specific service models to serve families better and to correctly model our prevention services. Hennepin is committed to working with community groups that will help us to accomplish this goal. And we thank Representative Loeffler for her foresight in addressing this issue. Thank you.
All right, thank you. Is there anyone from the audience that'd like to testify on this bill? All right, seeing none, member questions. Representative Schultz.
Thank you, Mr. Chair. I just want to thank Representative Loeffler for bringing this forward, and it's out-of-home placement, and the need for foster care families is really great in St. Louis County. So I think if Hennepin County can ease some of that burden, it will help our county as well. Thanks.
All right. Further questions? Seeing none, final word, Representative Loeffler.
Thank you, Mr. Chair, and members, thanks for your consideration, and I'm hoping we come back with some lessons learned that we can share with other counties, because we know everyone throughout the state is struggling to find enough good, caring families who will step up to this really difficult and important role.
All right, thank you, Representative Loeffler. Representative Loeffler renews her motion, and House File 3975 is laid over. House File 3169, Representative Schomacker.
Yep, Joe.
Representative Schomacker moves that House File 3169 be laid over. We have no amendments to the bill. Representative Schomacker has one testifier to introduce. Representative Schomacker, to your bill.
Thank you, Mr. Chair and members. House File 3169 takes away the requirement for children that are people who are under the age of 17 to have to be fingerprinted when they are in a foster home. And with that, I think I'll just move right to our testifier, Ms. Vandenberg, to explain a little bit about it and the need for it that we have today.
Welcome to the committee, Ms. Vandenberg. Please introduce yourself for the record and proceed with your testimony.
Thank you, Mr. Chair. My name is Marcia Vandenberg, and I am a foster care provider in Oak Grove, Minnesota. I have 10 children, 7 of them that I have adopted out of the foster care program. The youngest is 14. And when I went to renew or update my license, it wasn't actually a renewal, a few months ago, I was told that my most recently adopted child, who is 13, had to be fingerprinted in order for us to maintain that license. And my objection to that is this is a child who's been in the system almost their entire life and has had an extreme amount of trauma, and it was going to just re-traumatize this child. And I know that we're working towards a more trauma-informed care system here in the state of Minnesota, and so it's very difficult for these kids to then be fingerprinted because child development, TV, everything that they see means if you get fingerprinted, then you are a criminal. And so I have no problem with background checking these young people with a traditional name, age, and date of birth background check, but the fingerprinting seems excessive, and that is, we just heard testimony about how difficult it is to keep licensed foster care providers, and this bill would exclude those 13 to 17 from that fingerprinting requirement.
And, Mr. Chair, there was an amendment that was adopted in the Civil Law Committee at the request of the Department of Human Services that it gives the commissioner the authority to determine on some of that if he or she determines that there is a need for fingerprinting, that they can do that, but it's up to the commissioner then.
All right. Is there anyone from the audience who would like to testify on this bill? Seeing none, member questions? Representative Liebling.
Thank you, Mr. Chair. I'm Representative Schomacker. We heard this bill in your committee, and I support this completely, and I'm happy to see that it has a zero fiscal note, and I'm sure you are too. And I'm just wondering if this one's going to be laid over as well. You know, I think it's probably no secret that you're running the risk of maybe having it be in an omnibus bill that might not make it all the way through. And I'm just wondering why, or if you've maybe considered trying to run this separately so that we could this just seems to me like it's pretty non-controversial, and we could just, if it was sent to the floor, that it might be just something that could be done. Anyway, I just thought I'd kind of throw that out there since it has a zero fiscal note.
Representative Liebling, I think in order to make deadline, we would have had to move, certainly it could be moved through the Rules Committee if Representative Schomacker decides that that's a better path, or in another bill as an amendment. Representative Schomacker.
Thank you, Mr. Chair. Representative Liebling, I completely understand where you're coming from, and after this year, I've really understood the challenges and issues with the process that we'll probably get into with my later bill. But I trust the chair to carry this through, and so I'm confident and comfortable with just laying it over for tonight.
Representative Franzen.
Thank you, Mr. Chair. Representative Schomacker, is this language looks like it mirrors the fingerprinting bill for the child care providers, correct?
Representative Schomacker.
Mr. Chair, Representative Franzen, that is correct.
Okay, thank you.
All right, other questions? Seeing no other questions, final word, Representative Schomacker.
Thank you.
All right, with that, House File 3169 is laid over. Thank you to Representative Schomacker and to Ms. Vandenberg for being a foster mom and for being here tonight. Thank you.
Pardon me.
All right, next up, House File 3455, Representative Zerwas.
Shaking it up a little.
Representative Zerwas moves House File 3455 to be laid over. We have the bill before us. There's an A1 amendment. This is an author's amendment. Representative Zerwas moves the A1 amendment. Representative Zerwas to your A1 amendment and the underlying 3455.
All right. Thank you, Mr. Chair and members. The A1 amendment was brought to me by Minnesota Adult and Teen Challenge. The amendment was adopted in the other body on this bill, and they're trying to match the bills up. This is an amendment that was brought to me by Minnesota Adult and Teen Challenge on behalf of the entire chemical dependency treatment. It is supported by the Coalition of Recovery and Investments, Minnesota Association of Resources for Recovery and Chemical Health, and Minnesota Rural Alliance of Addiction Providers. The amendment does two things. It creates an exemption in the background check, disqualification, reconsideration process for individuals who wish to work with chemical dependency field, but are currently unable to because of drug-related, nonviolent criminal offenses. And second, it expands what is commonly referred to as a traveling set-aside to apply to this newly established set-aside. This means an individual does not have to reapply for this set-aside when they switch jobs. However, it's important to remember that DHS still retains their discretion to disqualify an individual if new information is discovered after the set-aside is provided. I have two folks from Minnesota Adult and Teen Challenge here that can answer questions or explain the positive impacts this would have on the treatment community in the state of Minnesota.
Representative Zerwas, I apologize. The A1 amendment was not in members' packets. So let's, what we will do is just lay
It's
the
really-
amendment over
It's
and
really, really good.
we'll lay the amendment over and
That work? No? Okay.
move on and we'll see if we can correct that on the fly. And if not, we can deal with that as we move on. You do have an A2?
Can we do the A4 next, Mr. Chair?
All right, let's do the A4.
All right, Mr. Chair, members, the A4 amendment relates to the Yellow Line project. This was also adopted in the other body, and we're trying to conform the language between the two bills. This amendment came to us from Blue Earth County and the Minnesota Inter-County Association. It addresses legislation that we passed last year relating to Yellow Line projects, which integrate social services with law enforcement professionals. Under that legislation, care is coordinated to focus on individuals who have been detained by law enforcement, who historically would have been incarcerated, but who may be better served through community-based intervention for their chemical and mental health needs. The department is in the process of completing the waiver request. In doing so, they requested a few necessary changes to the language that's reflected in this amendment. It specifies types of professionals that can provide the care, and under this amendment, Native American tribes will be able to participate in this process. This language has been agreed to by the counties and the department, and I would ask for members' support.
All right, questions on the A4 amendment? Representative Loeffler.
Well, thank you, Mr. Chair, and Representative Zerwas. As you know, I'm not on the Reform Committee, so maybe answered these questions in earlier, but we're changing the definition here from post-arrest community-based care coordination to officer involved. And I don't see a definition of an officer. I think you referred to it as someone in law enforcement who, you know, the law enforcement training program is not really about social services care coordination. And I'm wondering, is this really to authorize a new role for law enforcement officers to play as in providing and coordinating social services? I'm just trying to understand, you know, we seem to have a lot of license scope creep around here lately. And not that we don't want to encourage people to be creative, but I'm just not sure what the model is that we're authorizing.
Yep. Representative Zerwas.
Mr. Chair, Representative Loeffler, that's a fair question. That's an excellent question. My understanding is as the department applies for the waiver for the legislation that was passed last year, there was concern around post-arrest, since what we're trying to do is divert individuals from being arrested. And so they would be evaluated, determined that they would be better served with this community-based and mental health or chemical dependency intervention. The arrest, in fact, would not occur, and we would be setting them aside for, you know, social service intervention and not law enforcement intervention. We're trying to intervene at the fork in the road and prevent the arrest and the incarceration and get them into the social service end of things. And it was the department that had concerns about 2017 language that was passed as they started to fill out the waiver application. And this is the language that between the department and the counties they arrived at.
All right, thank you,
Mr. Chair.
Representative Loeffler.
I think the common usage, and I like these kind of programs, and I think they've shown really good success, is diversion. And that's the standard, both in criminal justice and social services. People know what you mean when you're diverting someone from criminal justice into treatment or care coordination. And I would ask you to really think about and talk with the Department of Human Services about that, because it sounds like your intention was not to turn law enforcement officers into care coordinators, but instead to enable a diversion program.
Representative Zerwas.
Mr. Chair and members, Representative Loeffler, I think that's great advice. I'll take that back to the counties and to the department.
Thank you, Representative Zerwas. All those in favor of adoption of the A4 amendment, please say aye. Aye. Those opposed, no. The A4 amendment is adopted. Let's go to the A2 amendment.
Thank you, Mr. Chair.
Representative Zerwas moves the A2 amendment. Representative Zerwas.
Thank you, Mr. Chair and members. The A2 amendment updates the bill following significant amount of negotiations between several stakeholders, including People Incorporated, which originally brought me the bill, and the department and the counties. Reflecting the final agreement that was set forth this morning, I do have an oral amendment to the A2 amendment, if the chair would be so kind to allow that.
All right. If you could read the oral amendment, and we'll see if we can incorporate it with staff.
All right, thank you, Mr. Chair and members. On the A2 amendment, on page 6, before line 25, delete sections 3 to 6. Page 6, delete lines 25 to 35, and then we would delete page 7, and we would delete, on page 8, we would delete lines 1 through 28.
Representative Zerwas, that's too much to chew on. Sorry, we're not going to be able to pick that up as an oral amendment. Sorry.
Mr. Chair and members, what I'll do is I'll ask for members to approve the A2 amendment and then work with staff to continue to reflect the negotiation. And I can explain what we arrived at today in order to get to a bill that the stakeholders are comfortable with.
Sounds good. All those in favor of adoption of the A2 amendment, please say aye.
Aye.
Those opposed, no. Representative Zerwas, the A2 amendment is adopted.
Thank you, Mr. Chair and members. We know the demand for behavioral health services in Minnesota exceeds the current capacity for our providers. This bill seeks to amend the process by which mental health and substance abuse disorder providers enter the market and transition ownership in a more efficient fashion. By removing some of the administrative burden from providers, providers will be more likely to engage in the process of opening new behavioral health programs, and thus the available capacity of behavioral health providers will increase. Many providers are ready, willing, and able to offer new behavioral health services, but are reluctant to allocate their scarce resources towards such an effort when they're looking at the process that may take a year or longer before they're ever able to yield operational revenue. The bill, as it will be amended, removes the requirement that substance use disorder and treatment providers, prior to submitting a license application, obtain a letter from the local mental health authority. And it creates a narrow exception to the general prohibition of the transfer of licenses and certification of certain types of behavioral health services. What we took out from the bill that was in the first version of this bill that went through the policy committee is we were also looking at whether or not providers needed to enter into a county contract. And the original position was that all of that was being ferreted out by the department along with the county, and that removing the county contract piece seemed like a way to streamline the approach. When the amendment is fully adopted, including the language, I'll get to the chair, we will remove the portion that would exempt the county contract and leave that in current statute.
All right, thank you, Representative Zerwas, and apologize for not being able to incorporate that. That was just a little bit too much for
No, I
an oral amendment.
I understand,
Wanna
Mr.
make sure
Chair, and
that
I
we-
apologize to the committee that this has been a really involved and engaged negotiation process, and we got there just really, really late.
All right, and it will remain with the committee so we can continue to look at that. All those in favor of adoption of the A2 amendment, please say aye. Those opposed, no. A2 amendment is adopted. Members, the A1 amendment was not included in packets. That was quickly copied and distributed to the committee by crack staff on the fly. I just want to make members and everybody know that the amendment was posted. It did make deadline. It just wasn't included in the packets. So that's the story with the A1 amendment, which is now before members, and Representative Zerwas moves the A1 amendment.
Thank you, Mr. Chair, and thank you, members. Apologize for jumping around on this one. As I had mentioned, this amendment was adopted in the other body, and we're trying to match up the language between the bills. It was brought to us by Minnesota Adult and Teen Challenge. The amendment creates an exemption in the background check disqualification reconsideration process for individuals who wish to work in the chemical dependency field but are currently prohibited because of a drug-related, nonviolent criminal offense on their record. Second, it expands what's commonly referred to as the traveling set-aside. This means that an individual does not have to reapply for this set-aside whenever they switch jobs within the chemical dependency field. However, with this language, the Department of Human Services still retains their discretion to disqualify an individual if new information is discovered after the original set-aside is provided. I have some testifiers from Minnesota Adult and Teen Challenge that could be available to answer questions.
All right, thank you, Representative Zerwas. Representative Loeffler.
Thank you, Mr. Chair. Whenever we do set-asides, we always should be thoughtful, and this references a clause 6 that isn't actually reproduced here under line 2.17, and I'm not sure what the references are to all the criminal violations. But I do remember a few years ago, and I don't think it was a constituent of mine, but I remember meeting with a woman who was quite distraught because she was accepted into a higher education program to become a chemical dependency counselor. She had felt like she'd gotten her life back by going through treatment and wanted to help other people in doing that, and went through the whole training program, and then was, after incurring that kind of debt that we see with people going through higher education, was denied access into the field because of our prohibitions. And this seems to address the situation when you've come out and are applying for licenses, but that still doesn't stop our higher education institutions from taking people into training who may or may not get this waiver that you're authorizing in statute. But I wish, I'd like to hear a little bit more about how you've kind of coordinated this, because so many of the people that are required to work in this field have to have post-secondary training and certification. And I just don't want us to set up more people to go through that process and then be incredibly disappointed at the end and emerge with debt that they can't accommodate. And so if you could just explain a little bit more how this would address that situation, because it looks like the waiver is granted or considered at the point you're actually applying for your license.
Representative Zerwas.
Yep, Mr. Chair and Representative Loeffler, you're correct. There's nothing that prohibits someone from entering a graduate field of study or a post-secondary field of study for something that they lawfully cannot do. You can be a convicted felon and enroll in law enforcement classes and go all the way through and not be granted a post license. This bill does not, this amendment does not aim to address that. What it does, at the request of Minnesota Adult and Teen Challenge, something that they encounter, I think, quite regularly, are individuals that have had real life experience dealing with chemical dependency issues and have overcome those issues and have attained the required credentials and are ready to serve their community and become gainfully employed. I know that we do have a testifier here that can maybe more thoughtfully answer exactly what they're seeing at Minnesota Adult and Teen Challenge and how this amendment aims to help them retain qualified personnel.
Mr. Walsh, welcome to the committee.
Well, thank you, Mr. Chair and Representative Loeffler. And thank you, Representative Zerwas. That's exactly right. If you want to look at this a little different way, this is for actually mostly entry-level positions. These are people who are maybe in a recovery coach kind of position, providing direct services to clients, staff who may come on, and even in a maintenance role, if they have a lot of interactions with clients, they may be excluded from those kind of positions based upon their criminal history, which is directly related to their drug offense. And so for those kinds of positions, we hire about half of our staff are former clients of treatment programs, and they typically have offenses that are related to their drug addiction. They've gone through treatment. They've had a year of sobriety. They've demonstrated in all other ways that they would make an excellent staff. In fact, I would say they're some of our most inspirational staff and some of our most effective staff. So they've gone through all of those measures, and now what is preventing them from employment is this background check and the failure to get set aside for that purpose. So I think what Representative Loeffler is also referring to is if somebody wants to go on to be a licensed alcohol and drug counselor, they would need actually 2 years of sobriety. That's addressed in another statute. And you're exactly right. They could go through that whole process with the assumption that they're going to get licensed, but they would still, it's still possible that they would be excluded.
Thank you, Mr. Walsh. And I enjoyed the tour that we were on down in Rochester at the convent. It's a beautiful facility. I appreciate that, and also appreciate you introducing me to this issue. Set-asides can be very, very controversial that we've seen in the past, where working with any vulnerable kids or adults, people with criminal records. We're obviously very careful about that, and the safety of vulnerable Minnesotans is a higher priority than the availability of people to get jobs. It just is. So that's why the safety is preeminent with that. We wanted to make sure that this is really dialed into substance abuse statutes, so that this is not violent crime, this is not sex crime, this is not, this is very narrowly tailored to that section of the law, and also to give a lot of ability for the commissioner to dial that in as well.
That's
so
exactly right.
I'm glad that's bracketed very tightly as opposed to other bills that we've seen come forward. So that looks better, and I appreciate that. Representative Albright.
Thank you, Mr. Chair, and to the author of the testifier. I'm just looking above on 2.5 where it says submission of sufficient documentation. And I think maybe the testifier by his own testimony gave me what I'm needing, but I'm just, sufficient doesn't mean specific, so I'm just wondering if you can just help me in terms of what would be deemed sufficient documentation. Is it specific documents or a specific term? of sobriety, what is that documentation? And maybe you've already answered and I wasn't listening closely enough, but just to help clarify that for me.
So, Mr. Chair and Representative Albright, DHS is here. They do have a specific process for submitting documentation for this very process, and so there they would define what is sufficient on the receiving end with DHS.
Mr. Chair, I'll take it up with DHS offline.
Thank you, Mr. Walsh. Other questions for the testifier or Representative Zerwas? Seeing no other questions, all those in favor of adoption of the A1 amendment, please say aye. Aye. Those opposed, no. The A1 amendment is adopted. Representative Zerwas, I think we've adopted the 1, 2, and 4. Is there other amendment?
Not that I'm aware of, not
All
that I
right.
have, Mr. Chair.
All right. Is there anyone in the audience who would like to testify on behalf of this bill or other testifiers, Representative Zerwas?
I think I have Mr. Turpin here if someone has questions. Otherwise, I don't have any other testifiers, Mr. Chair.
All right. Does anyone from the audience want to testify on this bill? All right. Seeing none, we'll close off the public testimony and open it up for member questions. Representative Murphy.
Thanks, Mr. Chair, and Representative Zerwas. Is there a fiscal cost to this?
Mr. Chair,
Zerwas.
Mr. Chair, members, I don't believe there is. This was really around kind of changing the license transfer process when a company takes over a facility. And I just want to say on the record that I apologize that I wasn't able to get the most recent version of the agreement with all the stakeholders drafted in time, but that as this is held over for possible inclusion, that we'll continue to work with the county, and we will have, if this is included in the chairman's bill, we'll have language that reflects the agreement with the county and with all the stakeholders. But I'm not aware of a fiscal implication with this bill.
And Mr. Chair?
Representative Murphy.
Representative Zerwas, you know, it is clear in your testimony and in the reaction to the people in the room that you've done a lot of work to navigate what could have been a complicated set of policies to find some conclusion. So I don't have a problem at all with the fact that, you know, it's not quite in perfect order. But I do wonder about if you have a path for this in addition to the chairman's bill. In case the chairman somehow becomes embroiled in something, because it seems like the work that you have done with all the stakeholders is worthy of a path through the floor if it doesn't make it, if we don't get through an omnibus bill. And so just, you know, I'm wondering if you are thinking through another route for a bill that doesn't have a fiscal cost.
Mr. Chair, members, Representative Murphy, I don't know if you've checked the General Register lately, but I have more life rafts than Carnival Cruise Lines.
And Mr. Chair,
Representative Murphy.
feel about Carnival Cruise Line.
I hope you're washing your hands.
All right. All right. Other questions? Seeing no final word from Representative Zerwas, House File 3455
Thank you, Mr. Chair. Thank you.
as amended is laid over. Thank you to the testifiers and thanks for hanging around tonight. Next up, we have Representative Pinto, House File 3574. Representative moves House File 3574 to be laid over. And there are no amendments. Representative Pinto, to your bill.
Thank you, Mr. Chair and members, and thank you, Mr. Chair, especially both for hearing the bill, but also for managing the testifiers with consideration of them and on a really busy day. So I'm really grateful for that. Members, as you know, our state has some of the worst disparities in the country between residents of color and white residents when it comes to educational outcomes, employment, and economics, criminal justice. I see this in my work as a prosecutor, and health. And members, these disparities start before birth. Mothers of color receive less prenatal care and less adequate prenatal care than do white mothers. Now, we already have a grant program within the Department of Health, within MDH, to address health disparities. And the bill before you, House File 3574, would expand that MDH program to encompass disparities in prenatal care, including additional funds to address these disparities. Mr. Chair, I have 3 testifiers and would like to turn to the first one, if I may.
Welcome to the committee. Please introduce yourself for the record and proceed in whatever order you'd like.
Mr. Chair, members, my name is Katie Kazimanel. I'm an associate professor in the Division of Health Policy and Management at the University of Minnesota School of Public Health. I'm also the director of the university's Rural Health Research Center. I conduct research on how best to improve the health and well-being of women, families, and communities, and I focus on pregnancy and childbirth in my work. In Minnesota and across the nation, Black and Native infants are twice as likely as white babies to not make it to their first birthday. Additionally, Black and Native women are 2 to 4 times more likely than white women to die giving birth. This disparity is shocking and hasn't changed in more than a century. The Eliminating Health Disparities Initiative at MDH funds community grants in key areas to improve health equity. The current focus on immunizations and infant mortality is good and important, but it needs to be broader and it needs to include moms. Maternal mortality is increasing in the United States. In fact, it's doubled between 1990 and 2013. I see this close up as a member of Minnesota's Maternal Mortality Review Task Force. I've served on the task force for the past 5 years. Racial disparities in maternal health in Minnesota urgently require attention if we are to meet the goals that are set forth in the Eliminating Health Disparities Initiative. One key factor is the importance of support and care during pregnancy. Prenatal care matters for eliminating racial disparities in birth outcomes, and there's good data and evidence to inform these community-based programs. From 2015 to 2017, I served on a national work group to develop action steps that clinicians and health systems can take during care, during pregnancy to reduce racial disparities. In other words, we know what to do. There is evidence. Reducing disparities is possible, and I can think of no better use of our resources as Minnesotans than to ensure safe and healthy births for all of our families. Thank you.
Thank you. Welcome to the committee. Please introduce yourself and proceed.
Good evening. I'm Akmiri Sakara. I work for the Cultural Wellness Center in South Minneapolis, and I am a birth attendant, a doula/doula. I've been a doula for over 25 years with all kinds of families and all kinds of mothers in the community. And I am here just to really support this addition because I've worked so long with so many families, and this project is very modest to be able to support the people that I work with. I just wanted to say that Black women are 3 times more likely than other women in the U.S. to die from pregnancy-related causes. And it's, I see it every day in the work that I do, and it would be so powerful because this week, beginning April 11th through the 17th, is the Black Maternal Health Week, and it's amplifying the voices of Black moms and to really center the values and traditions of reproductive health and also justice. And the things that we're going through here and seeing with our families it's a crisis. It's definitely a crisis, and what families need is really support. You have to just really know that this is how a family is born. And we're really doing an injustice of not being able to support them. Thank you.
Thank you. Welcome to the committee. Please introduce yourself and proceed.
Good evening, Mr. Chair and committee. My name is Dr. Nathan Chomolo. I'm a pediatrician and internist who lives and practices in the Twin Cities, and I am here today on behalf of the Minnesota chapter of the American Academy of Pediatrics, as well as Minnesota Doctors for Health Equity, to support House File 3574. As my co-presenters have eloquently stated, timely and adequate prenatal care is critical for both a mother's and a child's health. We know it helps improve birth outcomes by reducing the incidence of low birth weight and preterm births, and can help reduce rates of infant deaths and long-term disability. Supporting prenatal care by meeting mothers and families where they are at through innovative programs like home visiting has been shown to have a 2-generation impact. Mothers have improved parental attitudes, increased self-esteem, and reduced anxiety, while children have higher birth weights, stronger early socio-emotional skills, including reduced aggression and increased empathy, and the impact has been seen as far out as 12 years of age, with children having statistically significant improvements in cognition, as well as math and reading achievement test scores. So I encourage you to vote in support of House File 3574, as it will help give much-needed support to find solutions to decrease the inequity we see here in Minnesota, help give our mothers the care they need, and our children the best possible start. Thank you.
Thank you for your testimony. Is there anyone from the audience who'd like to testify on behalf of House File 3574? All right, seeing none, we'll close the testimony portion and open it up to member comments and questions. Representative Schultz.
Thank you, Mr. Chair. I just want to thank the author of the bill, Representative Pinto, and others for bringing this forward. I think we need to do a lot more than just this one bill to address these disparities and improve birth and maternal health outcomes. And there was a really good radio show on Minnesota Public Radio on Monday about the importance of doulas and midwives in helping address this gap. And so I hope we can also bring bills forward that increase reimbursement rates for doulas and help get more people of color practicing midwifery and doulas. So thanks again for bringing this forward.
Thank you. And Representative Pinto, I see that in the Section 3 of the appropriation section, you have a blank appropriation for the bill not yet fully fleshed out as a fiscal note in order, and what does that look like?
Thank you, Mr. Chair. Yeah, so the fiscal note assumes a $500,000 appropriation, and I think that is perhaps the view of the department as to some funding that would really make a significant difference. I left the dollar amount blank in the bill, recognizing that I understand the committee's going to need to make a number of decisions. I certainly would feel that this would be there really is no higher priority than making sure that every Minnesotan gets off to a great start and that we reduce the disparities that we see all the way along. But Mr. Chair, in response to that particular question, the fiscal note does assume a $500,000 cost, and that certainly seems appropriate to me.
All right. Thank you, Representative Pinto. Representative Loeffler.
Well, thank you, Mr. Chairman, and thank you, Representative Pinto, and for bringing this forward. I was taken aback by the idea that maternal mortality has increased from 1990 to 2013, that it's doubled. That is just shameful in this day and age. And if you have ideas on how, I think it's about 20% or more of the births in Minnesota are paid for out of medical assistance and public funds. And if there's some things that we can do in incenting our contracts to pay better attention to those moms, and at least making the publicly supported moms, reducing that kind of disparity, I would be glad to help work with you on that, because nothing should be doubling in the wrong direction at this time and age. Thank you.
All right, further questions? Seeing none, final word, Representative Pinto.
Thank you, Mr. Chair. I guess I just want to point out to folks on the committee that currently we have this goal of infant mortality, reducing disparities in infant mortality. And I know that we have a goal as a committee and as a state that we don't want kids to simply not die, which is what that standard is about, but make sure that children can thrive. And that's what this is about, is making sure that we can reduce these disparities that we see in prenatal care and then all the way along as well. And of course, there's so much more to do, but this is an important first step. Thank you, Mr. Chair, again, and thank you to members of the committee.
Thank you, Representative Pinto. And with that, House File 3574 is laid over. Thank you, testifiers. Next up, we have Representative Kiel, House File 1403. Representative Kiel moves House File 1403 be laid over, and there is an author's amendment in members' packet. That is the A180741 amendment. I will move the A180741 amendment. Representative Kiel, to your amendment in the underlying bill.
Thank you, Mr. Chair and members. I believe this is just a technical amendment, changing a date, a year, actually.
Representative Kiel, I understand this is from the revisor's office.
I believe
and
so.
Corrects the citation. Staff help out with that?
Thank you.
Mr. Chair and members, this amendment reflects that this statute was amended in 2016. So when we act on a statute in 2017, we need to be amending the current version of the statutes. That's all it does.
All right. Technical amendment. All those in favor of adoption of the amendment, please say aye. Aye. Those opposed, no. The amendment is adopted. Thank you. Representative Kiel, to your bill as amended.
Thank you, Mr. Chair and members. House File 1403 adds licensed alcohol and drug counselors to the list of healthcare professions eligible for loan forgiveness out of the state's Health Professional Education Loan Forgiveness Program. The LADC is eligible for loan forgiveness if the individual agrees to practice in a designated rural area at an eligible provider. Why is this important? According to Hazelden Betty Ford Foundation, we can expect that 31% employment growth rate by 2022 for licensed alcohol and drug counselors. According to the Bureau of Labor Statistics, more than 20,000 new counselors will be needed. 21,000, did I say that? Despite the need, it's hard to attract folks to the profession due to wage competition within the healthcare field, especially within behavioral health. And with me today, John Magnuson is here to testify.
Welcome to the committee. Please introduce yourself and give us your testimony.
Thank you, Chairman Dean, members of the committee, Representative Kiel. My name is John Magnuson, and I'm the Executive Director of MARCH. MARCH is the professional association that represents addiction treatment providers, professionals, and the public's interests in the issues of addiction care in Minnesota. While the federal state reforms around addiction have increased access for people in need of treatment, this has also placed new issues on our workforce readiness. At a time when we are experiencing challenges of workforce shortages, we're also in the midst of a national opioid epidemic. Representative Kiel mentioned some of the statistics that are driving our concerns. In addition to the ones that she mentioned, the Institute of Medicine also reports that annually 1 of 4 of our workers leave our workforce, and that's not to take another job. They actually leave because of the high burnout of this type of work. And MDH also shows the disparities between the urban environment and the rural, where in the urban there is 1 for every 2,200, and in the rural environment there's 1 LADC for every 7,000. And so MARCH is working to address these challenges on multiple fronts with multiple partners, and one of these solutions is the legislation in this fix. Adding an LADC to the list of healthcare professionals eligible for the loan forgiveness helps not only create an incentive for people to come in, but also by putting them in parity with the other professionals on the clinical team gives them, we believe, another reason to stay in the field and hopefully to reduce the other trend of people leaving. So in conclusion, all of our membership supports this. We've not come across anyone who is in opposition, and we hope that we can count on your support. Thank you.
All right. Is there, well, we have another amendment. This is the A1 amendment. Does anyone want to offer the A1 amendment?
Mr. Chair, I don't know if this might have been mine, but I'm not going to offer it.
All right. The A1 amendment is withdrawn. Let's see. Does anyone else from the audience want to testify on House File 1403? All right, seeing none, we'll open it up to member questions and comments. Representative Liebling.
Thank you, Mr. Chair. So Representative Kiel, I am very sympathetic to the purposes of this bill. I think that loan forgiveness is important. It's very important to help with some shortages that we have, which is what you're trying to do here. It's also really important because we know that higher education is costing a lot of money and a lot of students are carrying boatloads of debt. I think we all understand that. The concern I have about your bill, though, I'm reading the fiscal note. And, yeah, you're nodding. I know, you know where I'm going with this, I'm sure. So what you're doing here in the bill is redistributing a pot of money that exists that's already doing the same thing for other professions. And so the fiscal note notes that, that this bill means, without an additional appropriation for the expansion, awards in the new category would reduce the awards of other eligible professions in the program. And then it goes on to, talk about how this would occur. And it says the change would redistribute $400,000 per year from the existing appropriation and would reduce the awards for other currently eligible professions, physicians, dentists, pharmacists, mid-level practitioners, dental therapists, mental health professionals, nurses in nursing homes, public health nurses, and nurse faculty. So this is really a problem. I mean, we agree on the problem. But boy, this bill, I think, just really highlights that we need more money into this program. And that's why there was some thought about, raising the issue about the provider tax. A lot of us don't like the provider tax, and, no one likes taxes, especially Republicans don't like taxes. But obviously, if we want to help people with loan forgiveness, we've got to have money to do it. And I understood that this is currently funded from the Healthcare Access Fund. And as we know, the Healthcare Access Fund is pretty much going to go away. So maybe I'm wrong about that, about this, where that funding is coming from, but that's what I had understood. So, so what's in the bill, what's in the fiscal note is not additional funding for the program, except there is an additional cost for new administrative costs to do this. So we're taking more money away from the actual loan forgiveness for existing professions. So I guess this is more of a comment than a question, because I'm not opposed to this, but I don't know if it's licensed alcohol and drug counselor versus a physician, dentist, pharmacist, mental health professionals. I don't know how you choose. And we ought to be putting more money into this and not just redistributing the same pot of money.
Representative Kiel?
Well, I don't disagree with Representative Liebling that we should consider funding this, helping people to serve rural Minnesota, high needs areas in general. So it's something that we need to consider. I realize this isn't necessarily the funding year, so if we're not doing it this year, we have to really seriously talk about it in the next session.
Fair enough. Representative Loeffler.
Well, thank you, Mr. Chair, and I have an oral amendment that I won't offer, but I think we as a committee ought to think about it, and that the healthcare workforce shortage is so great, and we've seen so many of these. I think we should put together a loan forgiveness program for anyone who's willing to step up to the labor shortage issues in health and human services, and work really hard to use that as a recruiting tool to get people into this, because it seems like every licensed area is struggling right now, and that's not to take away from this group. It's just, it's a fact of life that we cannot get people to step up adequately into our workforce without helping them get through that hurdle. And I think we should think about a broad, bold approach when we restore that provider tax so we can actually step up and do something real with it.
Well, I won't be around for that, Representative Loeffler, but maybe you will, but we'll see. We'll see how that goes.
We'll see.
Other discussion? All right. Seeing none, final word, Representative Kiel.
I ask you to support 1403.
Thank you. With that, House File 1403, as amended, is laid over. Thank you, Representative Kiel, and thank you to Mr. Magnuson and the other testifier. Next up, we have House File 3857, Representative Kiel. Representative Kiel moves House File 3857 to be laid over. There are no amendments. Representative Kiel to House File 3857.
Thank you, Mr. Chair and members. As we have heard in many places, we have a serious problem with vulnerable adults and the abuse that has happened, unfortunately. And 3857 deals with the reports that we are seeking to get from the Office of Health Facility Complaints, making sure we have a better handle in the legislature on the reports, that they're being met, and what is happening with this, so that we can stop this entirely from, at least slow it up, if not get rid of it entirely. So this is really just to ask the Office of Health Facility, require their reports. So with that, I don't have any testifiers.
All right. Is there anyone in the audience who would like to testify on House File 3857? Seeing none, member questions for the author on 3857, Representative Pinto.
Thank you, Mr. Chair. I'm just wondering, who is the report submitted to? I just don't see that in the bill.
Representative Kiel.
It is to be submitted to the legislature.
Okay.
Through the commissioner.
Okay, thank you.
All right. Other questions? Seeing no other questions, Representative Kiel renews her motion that House File 3857 be laid over. Thank you, Representative Kiel.
Thank you, Mr. Chair.
Next, Representative Kiel moves House File 3308 to be laid over. I will move House File 3308 to be laid over. Representative Kiel has an author's amendment. I will move the A5 amendment. Representative Kiel to the A5 amendment.
Sorry, it's a little bigger bill. Got to make sure I got my stuff organized. Thank you, Mr. Chair and members. The author's amendment does a few things. First of all, asks that the information of the housing with services is posted, so that when you're going into a residence, that you know who owns, who's running the facility, but also who is backing the facility if it is a larger business. I think of Good Samaritan in my district. I have a couple of them, and then their home office, so that residents know who to approach and who to send their concerns or hopefully their best wishes on how well they're doing. And that's part of the bill, and the other part is to add some members to the working group. As you'll notice, I wanted to make sure that that we represented all of Minnesota, that we had rural and metro. I've had the privilege of visiting a number of facilities in Minnesota, and noticed the difference and the size that we deal with when we have these different facilities. So I wanted to be able to see things like area of aging council, both metropolitan and rural, added legislators to the working group, also the Minnesota Council on Disabilities, very concerned that I want to point out too that we want to remember that this is vulnerable adults from 18 to end of life. So tried to seek people that have input that are in all different walks of life. And then also on the section 2, added some more requirements for the working group that they have to, the duties that they need to do, making sure that they review the building design and the physical environment, dietary services, support services in general. We want to remember that unlike nursing homes, these are two different subjects. The building itself and the services are often two different things, and can be provided by two different services or can be provided by the business itself. So that's important. Also wanted to make sure that that they have that conversation about electronic monitoring. I know that there's been a working group on that already, but I think we need to talk about where that goes and with the stakeholders, the residents that are going to be dealing with whether or not they want recordings in their rooms, in their building in general. Let's see. Wanted to make sure that we have people that are involved in dementia, Alzheimer's, also, like I said before, rural, urban, and then the last one is, let's see, just making sure the working groups are of multiple areas. And then there's a fiscal note. I want you to note that we did not, in the fiscal note, this did not include, I added 5 additional regional ombudsmen to this this bill, and that is not in the fiscal note. So that was not included. So that would be the amendment.
All right, thank you, Representative Kiel. Discussion to the A5 amendment, Representative Loeffler.
Thank you, Mr. Chair, and Representative Kiel, on the first part of the amendment on page 1 on the information required to be posted. It's all mailing addresses. There's no phone contact, email, even for the on-site manager. When we have heard these really disturbing stories, people don't want to sit down and write a letter. They want to be able to get a hold of someone instantaneously who is responsible to make sure that they're informed of the situation, to make sure that they're aware of the concerns and the worries. And I would really strongly suggest that we move beyond a mailing address to actual phone, email, and mailing. I think in most cities that require licensing of rental properties, they require that kind of information from the landlords, even if you're just renting, a duplex or an apartment building. And for sure, this should be as easily accessible in terms of being able to know who's in charge and who to complain to, even if it's just the smoke detectors aren't working. I mean, there may be safety issues that they need to get addressed, they need to have someone accessible in an easy communication pattern.
Representative Kiel.
Yes, thank you, Mr. Chair and Representative Loeffler. I would agree with you. I think that's something that we can attach to that. I don't know if we can do an oral amendment to say, we'll just do it later on. Okay, thank you.
All right, Representative Liebling.
Thanks, Mr. Chair. Representative Kiel, I'm glad to see this attempt here to do this, because it's something I was asking about because of what the OLA said. But I just want to ask you, is there any teeth to the requirement here? Because we just have it as an amendment, I don't really know how it fits into the overall law, and I don't know if there's anything that, what if they don't? What's the enforcement of it?
Representative Kiel.
I guess I would expect that they would follow the law just as many of the other statutes that are already in law are supposed to be. There is no teeth in this portion, however, there is in other parts.
Okay, so, Mr. Chair.
Representative Liebling.
So, Representative Kiel, so this it says information required to be posted. This is pretty basic stuff, so, because we had talked about this before in another committee. So somebody who's actually living in one of these facilities needs to know who owns it, who they can go to. And yet, right now, we know from the OLA itself that a lot of the facilities, it's really hard to figure that out. So just because we're saying it in a statute, if there's no, it says required, but you're not aware that there's any penalty or anything, what do you do if if they don't post it in your facility?
Representative Kiel.
Mr. Chair, Representative Liebling, it is part of the survey. So they have, when they're surveyed, that has to be checked. And I, maybe Christine, would you like to?
Part of the enforcement that you can put into place is making it part of the home care survey requirements, no different than having your license posted.
All right, thanks, Mr. Chair.
All right, other questions on the A5 amendment? Seeing none, all those in favor of adoption of the A5 amendment, please say aye. Aye. Those opposed, no. The A5 amendment is adopted.
Well, this is what used to be.
All those in amendments? All right. Perhaps it would make sense for Representative Kiel to just brief walk through for the bill, the sections or the pertinent sections that you might think, and then we have several DFL amendments that we'll go through after that, if that would be helpful for members just to kind of get clued into the bill.
Okay, Mr. Chair. House File 3308 actually addresses some of the OLA, most of the OLA report. And first of all, I want to point out that, after hearing these heartbreaking stories of abuse, neglect, maltreatment, brought forward by the media and the committees, we worked toward waiting for hearing the legislative auditor's report, and then addressed the improvements that need to be taken care of by the Office of Health Facility Complaints. So this bill is really intended to provide transparency, accountability, and hopefully we will be able to prevent maltreatment for our most vulnerable adults in Minnesota. House File 3308, as amended, will take steps to protect vulnerable adults. One of the important things that are in this bill are the working groups. And I know everyone looks at that and says, oh, we're not handling it. But this is a very complicated, terribly intensive concerns that we need to take care of for our vulnerable adults. Whether we've got someone in a nursing home, assisted living, housing with services, there's just a multitude of different ways that people are choosing to live. And, we've gone from having a lot of people living in nursing homes to the bigger choice is assisted living. And I will readily admit, having helped my in-laws move in 1998, assisted livings have changed tremendously in that time frame. And we need to make sure that we bring those changes along. I think of when I visit that same assisted living now, the residents there have different needs and stay longer when they do have some challenging needs. And I think in defense of housing with services, assisted living, we need to also identify within that working group, what are the lines? The Office of Health Facility Complaints, when the OLA looked at them, said, they didn't have clear direction. I think we need to take that time in working groups to be able to identify all the needs, hear from a lot of different groups within Minnesota, both rural and metro, to be able to identify what needs to happen, or what we need to address and how we handle that. The bill takes takes to heart the OLA's reports. We create 2 new panels within the Office of Health Facility Complaints. And really, that is the most important thing, that we make sure that the Office of Health Facility Complaints does their job, collects and applies the data, which will help us to decide exactly where we need to address it. I've asked the department, we don't have Department of Human Services for data. We don't have all the breakdowns. We don't know. I have numbers from 2017. It shows that not quite half of the complaints, a huge amount, not all were substantiated, are 64 and under, the age of 64 and under. So it's something that we need to see the data to address and know what we need to be doing here. We've heard a lot of awful stories, just really sad, and they need to be handled. So with the panels, the requirements for the OHFC, that is so hard to say all the time. Office of Health Facility Complaints, and making sure that when a complaint is filed, that it is actually addressed and handled in a very precise and urgent manner, so that those that are substantiated are handled within hours, days of when it happens. With me, I have Christine here, and would like to.
Welcome to the committee, Ms. Bakke. Please introduce yourself and proceed.
Thank you very much, Mr. Chair. I'm Christine Bakke. I am the CEO and administrator at Madonna Living Community in Rochester, Minnesota. We are part of the Benedictine Health System, which is a not-for-profit organization that has served seniors not only in the state of Minnesota, but in North Dakota, Wisconsin, Illinois, and Missouri. We are in Rochester. We serve about 600 seniors per year in a continuum of care in 3 campuses. So we provide skilled nursing care, we provide memory care assisted living, the traditional assisted living, and independent housing. I have been an administrator for 21 years, but before that, I was a caregiver. I had a grandmother who was in a nursing home for 13 years. As a young child, I spent lots of times in nursing homes helping my grandmother, and was fortunate enough when she finally passed away to be with her and watch the caregivers come and support the family through the end of my grandmother's life. And it was in those moments that I knew what I wanted to do. I wanted to help as many people as I could have the experience that my grandmother had, which was significant love and support. And our family had that as well. The stories you're going to hear tonight, they're horrific. I can't even imagine the range of feelings that these families and the residents have gone through with these experiences. And there is no excuse. There is absolutely no excuse that anyone should have to tell these stories. But it's not the only story out there. We have thousands, hundreds of thousands of people served in Minnesota over the years that have had exceptional experiences in all of these settings that have not experienced these situations. AARP has ranked Minnesota as number 1 and number 2 in our nation over many years for the care that we provide seniors and the range of options that we provide them. So we have a system that does function at a very high level across our country. Every day, providers work to ensure that we give high-quality, person-centered care. You have heard this over and over, not just tonight, but over the years as well, that workforce has become a very strong issue, not just for us, but for almost every industry. But finding caregivers that are committed, that are willing to stay, that are willing to do the physical work, the emotional work that goes in caring for our seniors has become challenging because it's also a low-paying job. We do background checks. It's a requirement. It's not an option. We have to fingerprint our staff and run criminal background checks before we can even employ them. A few years ago, we put in a system where we do the fingerprints. It's a great system, but it delays our hiring process. And many times we lose good applicants because they're offered jobs elsewhere for the same amount of money without going through the same level of scrutiny. Then there's the maltreatment cases, and you referenced OHFC. OHFC is at times our partners. However, when we have an issue of maltreatment, neglect, or abuse, oftentimes the provider has investigated, retrained, terminated, disciplined that employee before the state has even responded to the complaint. When that happens, especially if we terminate employment, that employee can go down the street and get another job working for another senior living facility. And it could be 6 months, 2 years, 3 years before anything is done with the complaint. That is not acceptable. So recognizing the challenges of what we are dealing with, we have a lot of providers that have a lot of best practices that we implement in our organizations, because there are many of us that say, this is not going to happen under my watch. That is a fear that many administrators have, is that one of these stories will happen in our facility, and what can we do to make sure it doesn't? There is everything from hiring practices, orientation and training. There is constant ongoing training. The state and federal regulations, for many of us, are a minimum requirement. They're not the maximum requirement. Many of us go above and beyond what is required in the name of the law. We have quality improvement. And again, there are requirements in the state laws as well as the federal laws for what we are supposed to do related to quality improvement. But many providers, including myself, go well above and beyond this, doing quality improvement meetings weekly, monthly, including our floor staff, including our medical directors, including our residents through the processes. We implement mentors. Mentors are so critical in our training processes. That's not a requirement. We go above and beyond because we want to train people using the best caregivers we have to train new people coming in. The governor's task force has a lot of recommendations, and I will not tell you that all of them are bad. I won't. Those recommendations are meant to protect our seniors, which is something we all want to do. But that task force left out very important stakeholders of the process. We have providers who have implemented best practices in their organizations that did not get to sit at the table and share how those could be implemented in a broader context. And those ideas did not even get considered. And those ideas are working for thousands of residents in Minnesota. This bill, House File 3308, allows these providers, as well as our state agencies, our ombudsman, OHFC, the Department of Health, to be a part of the table and be a part of the solution to look at what best practices, what consumer recommendations will and won't work, and how we can collaborate together, because the goal is to take care of the people we are serving, which is our seniors. Thank you.
Thank you for your testimony. All right. I think we'd like to move to amendments. There's several DFL amendments. Oh, sorry. All right. Is there anybody in the audience who would like to testify on this bill? All right. If you do, please talk to the pages. We do have several listed testifiers who signed up. We'll go to the list first, but if you would like to testify, we can do that as well. Joan Wilshire is the first up, followed by Josh Berg, then Mary Jo George. Welcome to the committee, Ms. Wilshire. Please introduce yourself for the record and proceed with your testimony.
Good evening. Yes, my name is Joan Wilshire. I'm the Executive Director of the Minnesota Council on Disability. For the last 45 years, my agency has been advising the governor, state legislature, and state agencies and the public on disability issues and on accessibility issues as well. And I want to thank Representative Kiel for recognizing the importance of including the perspective of people with disabilities in the assisted living work groups. Assisted living is one housing option, and not only for elders, but for people with disabilities too. I would also like to point out that 1 in 3 adults over age 65 have a disability. The council is the only state agency with an accessibility specialist on staff, and an important piece of ensuring that safety of all assisted living residents is making sure the physical settings and building design of these facilities are fully accessible to everyone. So we want to thank you again, Representative Kiel, for listening to us on this point. But I think it's critical that establishing assisted living licensure is a part of this legislation. These working groups need to focus on the details of how assisted living licensure would work, not if they should be licensed. It's time for us to start working on this problem we all know exists and to commit to a real change in how Minnesota protects its elderly and people with disabilities. Thank you.
Thank you, Ms. Wilshire, for your testimony. Next up, we have Josh Berg.
Thank you, Mr. Chair and members. My name is Josh Berg. I'm the Director of Services for Accessible Space, Inc. I just simply wanted to reiterate what Joan had said about inclusion of individuals with disabilities as part of the working groups. I think it is massively important. ASI, Accessible Space, we provide assisted living services to individuals with disabilities, brain injuries, mobility impairments across Minnesota in 16 assisted living properties. So it is important, and it will impact thousands of individuals, all these language changes. And I just want to point out some of the things with some of the possible amendments that are going to be brought forth. And Representative Schultz, Liebling, Murphy, and Allen, you guys all have sites of ASI in your districts. Representative Murphy came out and visited one of ours. So keep that in mind as we bring forth these amendments, or if these amendments are proposed. And you said it with an earlier bill with House File 118 that you don't want to cause harm. One of these amendments, I think it was the big one, A3 amendment, will cause harm for some individuals if this is put forth and if this is included, specifically with the AL licensure piece. If we try to rush this, it will cause individuals with disabilities choices to be made. They will not be able to live in the places that they are currently living, or they won't be able to receive the services that they're currently receiving. So I encourage you to slow down the process, let these working groups do their job. This is a very complex system, and it is one that if we bring all of these groups together, I'm sitting back here with Jean and Kay and those from Elder Voice, we can do this together and we can have good discussions, we can agree to disagree, and we can bring this discussion to a good spot, but it can't happen so quickly. So I encourage you to go with what Representative Kiel's got here. Let's work through the process. Let's do it right and thoughtful, because there are so many issues with some of these amendments, whether it's the interested person stuff, the electronic surveillance that needs to be vetted and talked about so much more, and so many other things. So thank you for including individuals with disabilities in the discussion, and trust, I think, that we're going to work through this. I myself as a provider with Leading Age and others, along with the advocates, AARP and others, we'll get through this. So thank you.
Thank you for your testimony. Mary Jo George.
Good evening. Mr. Chair, members of the committee, my name is Mary Jo George with AARP, and I'm here on behalf of the Elder Abuse Consumer Coalition, which includes the Alzheimer's Association, Elder Voice Family Advocates, Legal Aid, and the Minnesota Elder Justice Center. Joining me also are family members who will share their stories of abuse and neglect. First, I just want to start by saying, thank you, Representative Kiel, for holding hearings on our consumer recommendations in our bill in your aging committee. Unfortunately, we're here to say that we want Representative Kiel and lawmakers to do more. As we reviewed House File 3308, we have concluded that it fails to make the necessary changes to both our civil and criminal laws to prevent elder abuse and to hold abusers accountable. While there are some modest changes, we do think the bill must be strengthened. For example, the bill does nothing to provide protections against arbitrary discharges, deceptive marketing practices, or protections against retaliation. And tonight, you're going to hear from families who have suffered without these rights. These rights are particularly important given the marketplace today for senior living that bifurcates the home care from the housing services. We believe this is resulting in many housing providers to overpromise what they can deliver to older vulnerable adults. Moreover, as Representative Kiel has indicated, the population living today in assisted living facilities are very vulnerable. 39% have dementia. Significant numbers of people need help with daily activities for living. We think we need some discharge protections. We do, fortunately, provide discharge protections for vulnerable adults in group homes today. We do for nursing homes. So why not for our elderly population and for people with disabilities in these facilities? While the bill amends the grievance section by saying people can exercise their rights, there is no meaningful way to enforce them in this bill. Lastly, we are concerned that the Task Force on Assisted Living only considers whether or not we need new regulations and dementia care standards. We think the question is not if we should regulate, but how we should regulate these facilities in order to create safe standards for care. We are an outlier. We're the only state in the nation that does not have public oversight of these facilities. And our neighbors in Wisconsin and North Dakota and Iowa all do. So again, tonight we're here to urge lawmakers to do more. And thank you for the steps that you have taken, but it doesn't go far enough. And at this point, I'll hand it over to Chris.
Thank you. Thank you, Ms. George. Ms. Sundberg, welcome to the committee. Please introduce yourself for the record and
Sure. Thank you
give us your
very much.
testimony.
Thank you, Chair Dean and members. I'm Chris Sundberg. I'm president of Elder Voice Family Advocates, and we are a nonprofit volunteer organization composed primarily of family members and other stakeholders who have had horrific experiences with their loved ones being abused at senior living, home care, and long-term care facilities throughout the state. We ask that you strengthen this bill, as Mary Jo has just outlined. The abuse of elders and vulnerable adults is far from rare. It is epidemic. The reports of complaints are escalating at an alarming rate, rising from 4,000 in 2010 to over 24,000 last year. They are coming from nearly every county in the state at a current rate of 400 per week. This is rising because the long-term care industry is broken. I hope that you have had time to review the copy of the investigation reports from your respective areas. They were dropped off on Monday, and perhaps you feel like we did. We were shocked when we reviewed a lot of this information. Residents have suffered long, painful deaths or had limbs amputated because of untreated infections, ignored emergency conditions, or the failure to give basic care. Additionally, many are malnourished because they're not being fed enough nutritious food or given the necessary assistance to even eat that food. Others report sexual assaults by other residents and occasionally by staff. There are also many instances of broken bones, bruises, festering sores, and abrasions that are a result of physical abuse, mishandling, and neglect. In other cases, residents have been left for many hours without being moved, fed, given water, or even kept clean. Cruel treatment is often reported, such as hitting, insulting, belittling, scaring, and many other humiliations. In my case, my father's body laid in his room for 7 days without the facility doing a wellness check. We were told, however, that they would do so if he didn't show up for a meal. Well, obviously, they failed miserably. Not only did he miss his meals, the newspapers were piling up outside his door, and a neighbor across the hall said, "Please check on him. I haven't seen him." 2 of the residents came to my son as we were cleaning out his apartment, which, by the way, we had to have a hazmat team come in to take care of things before we could even enter. And most things, anything of any kind of fabric had to be destroyed. But anyway, these 2 residents came and they told him, "We're afraid." And I'm sorry, nobody should be afraid to live in their senior living facilities. I believe this might not have happened to my dad if there had been licensure with clear standards and a prohibition on deceptive marketing. Please do not let the senior living care industry continue to do business as usual. Business as usual will only result in more suffering and premature, painful deaths. And I do want to end by saying there are excellent providers, and I thank them. We all thank them. But the bad ones are really bad. You are the only ones who have the power to make the systemic changes that will end this suffering. Thank you for your kind attention.
Thank you for your testimony. Next up, we have Mr. Lynn. Welcome to the committee. Please give us your testimony.
Mr. Chair and committee, good evening. My name is Eric Lynn. Just to share my story, my mother Irene was diagnosed with Alzheimer's at the age of 58. Mom passed away last year in April at age 65. Thank you for listening to our story, which has been nothing short of a nightmare. Mom was a caregiver herself, working as a nurse's aide for over 20 years. After diagnosis in 2009, she lost her job, her privileges to drive, her home, and her dog. Yet when it came time for her to be cared for, we discovered that the facilities where she would live and the staff who worked there had little understanding of her needs as a person living with Alzheimer's. They promised us quality care but failed to provide basic care. They assured us they had proper security measures, but she was able to leave unattended. Eventually, she found herself discharged and rejected from several places. I asked myself, how did our family get here? You make the very difficult decision to move your mother to an assisted living or what you think is a memory care facility. Your belief is that a care facility is surely licensed and has professional caregivers that have been well trained. After all, this is what the brochure states. This is what the website shows. You finally convince yourself and family to visit a facility. You're greeted by the manager and shown a beautiful leather couch and a stone fireplace. The promise of a home-cooked meal, relaxing bath time, and an overall wonderful experience. But what is the reality? 5 months into Mom's stay at the first facility, she wandered away. She crossed a major county road before being discovered by a vigilant neighbor. This traumatic experience led to a 10-day hospital stay where an untreated urinary tract infection was found. Then the facility stated they would not readmit Mom and cancel our housing agreement. We were given 24 hours to take Mom home or find another facility. We had no appeal rights and no real plan to help her safely transition to the next facility. We found another memory care unit, but the incompetent care was just too difficult to accept, and we, her family, provided the basic care that the facility was unable to provide going into the facility. The third facility under competent, compassionate RN gave us hope. Mom's condition improved and she actually rebounded. But 3 months later, that RN was chewed up by an administrator who cared about filling beds and charging for everything possible. We were right back to daily challenges, lack of leadership, and Mom's condition would soon show the effects. In her dying days under a hospice care plan, the facility failed to communicate and follow the plan. We were forced to take Mom to my home to die and assure dignity under our watch. Every dollar our mother worked for and saved went to 3 facilities. She paid to be neglected over and over again. We became accustomed to hearing, if you don't like it, get out. If you cause problems, we will evict you. A kick-the-can solution is not enough. families like ours can't wait another day, much less a year or 2 or 5, for more groups to talk about the problem. We need solutions today. I'm asking you for my mother to prohibit misleading advertising and promise to protect them from being kicked out of their homes. Commit to a license structure that would have protected my mom and made sense to us as her family caregivers who wanted to do the best for her. So thank you for your time today.
Thank you for your testimony, Mr. Lynn. Ms. Winchell?
Yes.
Welcome to the committee.
Thank you. Mr. Chair and members of the committee, my name is actually Suzanne Scheller. I have the privilege of reading testimony from Barb Winchell, who was here earlier in the day but could not make it back this evening. My name is Barb Winchell. At age 90, my mother was admitted to an assisted living memory care for services related to advanced dementia. The decision to admit her was particularly difficult for my 90-year-old father and my family. The assisted living was chosen after representatives from the assisted living facility had assessed Mom at her home and stated that it could meet her needs. We became concerned about several lapses in care that placed Mom at risk and communicated those to the assisted living administrators. For example, the footrests were often taken off her wheelchair, but when being transported, the footrest should have been on her chair to prevent her feet from dragging and abruptly stopping the wheelchair, creating a fall risk. Often the staff was in a hurry and neglected to be watchful of Mom's dragging her feet or did not take the time to add the footrest to prevent her feet from dragging. On 2 different occasions, Mom was projected out of her wheelchair to the floor while being transported by staff. Both incidents resulted in trips to the ER for significant facial and head trauma, skin tears, and hospital stays for a concussion. In meeting with the administrator staff, we expressed our concerns. We were told that the fall was Mother's fault because she dragged her feet. The facility did not change her care plan or otherwise intervene to reduce her risk of falling. We filed a maltreatment report with the Minnesota Department of Health about the falls. Within approximately 60 days of filing the complaint, we received a letter of termination of home care services, stating generally that the home care provider could not meet my mother's needs. The letter did not state what needs could no longer be met. My mother had no assessed change in condition. Our family asked for a meeting with the home care provider to attempt to work out a solution. At the meeting, the home care provider communicated, again, no change in condition to warrant an increased level of care or discharge. We stated that we would bring in nursing services of our own, as allowed in their contract and as an option to assist with care. However, the landlord spoke up at the meeting and stated we were not welcome. So now my mother, who had advanced dementia, had to be reorientated to a new living arrangement. We were concerned about the effects of moving on her and on my father, who would have to drive a greater distance. We ended up moving my mother to another assisted living. At the new facility, she did not have a fall, and she entered in at a recommended level 2 service package compared to the level 4 at the previous facility. My mother experienced retaliation in the form of an arbitrary discharge. Had there been even the most basic protections in place, her discharge could have been addressed. There were no limits as to when they could discharge my mother. They did not even tell us why they couldn't provide services any longer. There was no way to appeal the termination, which could have allowed at minimum extra time to find a new suitable location. 30 days is not enough to find a new place with advanced dementia. We had no assistance in finding the new place. The landlord said we could not bring in our own service, so we had no power to stop the arbitrary termination. We had no options. We urge you to strengthen provisions for residents in House File 3308. Assisted living needs to be licensed. Termination of services and housing must be appealable. Retaliation is alive and well, and it must be stopped. Thank you.
Thank you for your testimony. Ms. Patty Sager, welcome to the committee.
Mr. Chair and members of the committee, my name is Patty Sagert. Thank you for hearing my testimony today. My father, Dennis, was diagnosed with Alzheimer's over 10 years ago. We knew finding the right care setting for him might be a challenge, but we never imagined having to encounter so many broken promises. In less than 3 years, we have had to move my dad into and out of 3 different memory care facilities. Along the way, he's had 6 stays in hospitals and transitional care facilities. When we started the process, we spent a very long time before deciding on a small assisted living memory care setting that was supposed to be his forever home. Unfortunately, our trust with this facility was irreparably broken when he was transported and left unattended in a local hospital for over 12 hours. They never even alerted our family he was there. As we looked for a new home for my dad, we thought we were being more careful. We settled on a beautiful new place, promising 24-hour on-duty nursing care and a nationally recognized memory care training program required for all employees. But we soon learned that the staff members were not actually receiving the nationally recognized memory care training. We have encountered many exceptional caregivers, those who are always the first to fill in when someone else missed a shift. But we also saw firsthand, and we continue to see firsthand, that those long hours worked and multiple shifts lead to burnout. My dad and his fellow residents suffer as a result of this. At the second facility, I met with the facility leaders and 2 regional directors to discuss our concerns. My reports fell on deaf ears. Instead, we were subjected to retaliation, and the facility began misrepresenting my father's behavior and actual care needs. I sensed they were trying to force my dad out. Shortly after Thanksgiving of 2017, my father suffered a stroke and went to the hospital for a short recovery. Even though we had been assured that they would be able to care for my dad up until his death, the facility would not allow him to come back home to his memory care unit because he couldn't feed himself. After his stay in the hospital, it was another broken promise. We were left with no option but to move all of his belongings out of this facility that very day. After spending 60 days in transitional care, we moved my dad to his 3rd memory care facility. I am hopeful, and I'm really an eternal optimist. I really hope that the voices of these family members will have an impact on all of you and that they will be heard and not overshadowed. We call on you and urge you and pray that you will adopt the structural recommendations made by the Consumer Work Group Coalition. I don't want to see any other family suffer through sleepless nights and emotional turmoil, struggle with the same problems our family has suffered. Thank you.
Thank you for your testimony, Ms. Sagert. Next up, we have Sheila Van Pelt. Welcome to the committee.
Hello, Chairman Dean, members of the committee. My name is Sheila Van Pelt. Throughout the course of the day, it's come to be what I had as written testimony. I'm changing up a bit. First off, I first came to the legislature in 2012 for events that happened to my mother. I had a concurrent investigations done, one with, both with the Minnesota Department of Health within the Health Regulations Division, a facility investigation and an HMO investigation. And both were wrought with problems and still with major problems, even with an HMO one that we aren't even discussing. What I have seen in these investigations is falsified data that gets through the cracks. And there's a dark story here. But before I get to that, I just want to say with the working groups, to add to the working groups, when it comes to the citizens portion of it, or a family member to be involved in the 3 working groups, I'd like to see that we have an established voice there. We have care providers noted and leading age. And then I really do look back at what ARP has, Elder Voice. They've shown that they are established and a credible group. And I hope that they, or between one of them, are recognized to be a member to sit on all in these working groups. So we have their voices of people who are not only just living in these facilities, but who have lived and have suffered, but who can bring that real human voice, because Elder Voice, they're not paid to do it. They're doing this because they're gathering so many people to make voices of people who have, again, no voice, maybe not the right word, but they're making them alive and they're credible. So I hope that they will be considered to your working group. What I just want to make sure is know that I volunteer in a nursing home every Friday. I see a lot of different sides. I see wonderful caregivers. And then I see things that aren't so great. And my point is Representative Liebling, when you said we need to put teeth into some of these different things, we already have teeth in what our penalties are for people who falsify data or retaliation. And believe me, I have been retaliated by both the HMO at a tune of $6,000, $7,000 a day, various things. The facility, they wouldn't even let me buy medical records. Needless to say, I have a no trespassing notice given against me. Police are involved, but then I'm telling them, listen to the tape recording I have with the administrator. Okay, but the point is, my recommendation has been to the state for a long time when it gets back to tainted data. Okay, right the other day in the paper, state faults Egan Senior Home after resident found dead in room. Again, like Christine Sundberg's father, papers are outside, but the records say that they did their well check. Okay, and then my particular situation, I see what was provided to the state. Falsified records. I was there to see the event unfold. Health Partners, for instance, I'm going to use that name. The HMO, a part of this, gave me a gift of saying for 1,361 pages I received, they were signed and notarized as a full set of records, and they were not. It's only because I vested over $1,000+ and getting documents everywhere. I have the missing documents that they don't even have, that they didn't even report to the state. So they come into these facilities and they're immune from all of this. But then you've got provider groups who are, God willing, all of them want to do a good job. But then also for the great providers out there, what happens when something goes wrong? What are they going to provide in their medical records? What are they going to provide to the investigator? And are we even going to care? And in my particular case, I fought this so hard. I went up to the Maltreatment Review Board and only find out the state of Minnesota investigated the wrong facility. All my rights were taken away, but they were proud. And I've used this word before. It's like the Wizard of Oz. You've got this big booming voice coming out to you saying, I'm the wizard. Dorothy goes out and they do everything they're supposed to do everything right, and they come back, and then the curtain's opened up, and it's just a person behind there. Okay, I have come to the state in good faith, showing facts and data through the years. 2013, before I even met with the governor's office, I understood communications were being transcended to the governor's office about me, and I was being watched. I requested to meet with Governor Dayton in 2013 because of a chair of a committee who said you should meet the legislative auditor, Mr. Noble, Commissioner Ellinger, and then Governor Dayton. I never thought I was worthy of it, but I did, and I pushed on, and I'm glad I did. But what I found out is Governor Dayton didn't meet with me, but his Health and Human Services Policy Advisor met with me. I've asked for the state to investigate the MDH because they aren't checking out and doing their job in ways that they should. And I will tell you this. 2016, Lauren Gilchrist, former Health and Human Services Policy Advisor to Governor Dayton, told me that Governor Dayton's aware of my issues and we're working on them. These are systemic issues and issues of wrongdoing in the state and known to the OHFC and the governor as a whole, all the way up. Nothing has been done but to contain me in my words of facts and data that get at the heart of systemic issues and wrongdoing that are known. And these working groups are great. They are wonderful. But make sure you have families in there that are going to give it to you straight. Because I see enough dancing around the issue. I go to the finance board and I see all the lobbyists there are for the two provider groups that are major here, and all the influence and all the unspoken things that are done. But there are people out there who are suffering, and the MDH knew this was going on and contained it. To what, preserve a reputation? I've seen enough. I've seen the dark side. And there are people here who have seen the dark side with the facilities, with the provider groups, but I've seen it within our own state government. And I'm going to say this, I mean well from the bottom of my heart, but we are cutting down the messages of what do we put out there. People are suffering, and what are we doing to protect them? And I just urge you, when these working groups come together, look out for the people who are really suffering. Thank you.
Thank you, Ms. Van Pelt. Ms. Alice Albert. Last on the list. All right. Were there other folks from the audience who signed up to testify with the pages? Or anyone else who would like to testify on the bill? All right, seeing none, let's go to close off the public testimony portion of the bill and open it up for member questions and comments. Members, Representative Loeffler.
Well, thank you, Mr. Chair, and Representative Kiel. You started out your presentation by saying this is complicated. And I think it's complicated only because there's such a long list of things for us to do that have been identified. And I must say, and then you said that the most important thing is for the office, the healthcare facility, to do its job. And I totally disagree. The most important thing for us to do is to immediately do all that we can as policy leaders and law writers to stop the abuse, the maltreatment, and the retaliation that's taking place and making people afraid to even identify problems for fear that they're going to get kicked out with 24 hours notice. And there's been a lot of work done. It started with the Star Tribune's articles that I think made a lot of us go, whoa, what's going on? But then it was followed by a 58-page report done when the governor created the task force, invited everyone around the table to look at this and identify the issues and come forward with some really strong recommendations, followed by an 122-page legislative auditor report. So we have over 200 pages of assessment of the issue and strong suggestions on how to move forward, proven paths forward, adopted and proven in other states. We're the only state that doesn't regulate our assisted living, housing with services industry. We can't pretend we have to start with ground zero and convene a task force. We need to step up to stop what's going on. We should be ashamed, all of us, and I include myself in that we went from 4,000 reports or allegations of maltreatment and abuse in the year 2010 to over 24,000 in 2017. That's a shocking rate of increase, and we have responsibility to make sure that our people are safe in facilities that we pay a lot of money for out of taxpayer dollars. They pay tremendous amounts out of their lifetime savings. And they, more importantly, trust their happiness and the quality of their life and their ability to thrive to those caregivers. And they're counting on us as the supervisors and the guiders of this system to be making sure that that is a system worthy of trust and worthy of the care of the most precious thing that you can have, which is your quality of life. That's what we all want, no matter what we're suffering from in life, no matter what our disabilities are, whether we have an unknown number of years and months ahead of us, or we know it's less than 2. 2 months. You want those 2 months to count, and you don't want them to be fearful and to be afraid of neglect, and that no one will check in on you for 7 days. That's amazing when these people are paying thousands of dollars a month for this care. The 24,100 reports a year that we have now established as a baseline is 66 reports a day. 66 people a day are being reported. Who knows how many aren't being reported? You know, the word's out, nothing much happens. But 66 people a day have someone who steps up and says, this person we think is being abused or maltreated or neglected, and their care needs are not being met. I think we have a responsibility as policymakers and overseers of the system to step up. That means that since I got here this morning for my first committee meeting at 8:15, that 5 people have endured the kinds of things that we heard about today. 5 people. 5 families are going, what the heck is going on? What can we do? And if we say something, will we be kicked out? This bill doesn't do anything about the retaliation. That should be, I mean, nobody should be afraid to say, I don't think grandma's getting her medications. I don't think she's getting turned. The bed sores are getting worse. I don't think he's getting sufficient nutrition because he is losing weight rapidly. What is going on? That's 5 people since I started my day. We need to have a sense of urgency about this. This, at the rate that I've seen in these reports, 88,000 people a year are served by our senior and assisted living and housing with services facilities. At the reported rate, if they were spread equally, and they may not, you may have some bad apples that get lots and lots of reports, because I know there are good facilities out there with good caring people. But if it was spread evenly, your chances are less than 1 in 3 that you are going to have a report of neglect or abuse or maltreatment filed against you or about your care. Less than 1 in 3. That is just not acceptable. These people deserve to have their care needs met. They deserve to have a sense of urgency. Not only is there no protection against retaliation, which is a real threat when someone can kick you out in 24 hours notice, that's a scary sort of thing when you're vulnerable and you're dependent upon others. And not everyone has caring family like the witnesses that we've heard from, or their family may be working in California and rural Iowa, and they can't only come up here on weekends, so they may not catch everything. Not everyone, some people outlive their family. I had an aunt of my husband's who lived to 110 and a half. And bless her soul, she had a pretty good run. She didn't have many problems till she was 110. And that last half year, I think she was ready. But, you know, that's not the situation for lots of people. And not only do we not make progress, but we actually have lessened the protections. And I'm just going to call out one thing on Section 2 of this bill, which is correction orders. Okay, this is when we have decided something is wrong. It has been substantiated. It has been investigated. And what do we do on line 2.16? We used to say that the department should specify the time allowed for correction, which for some of these offenses should be like by 5 o'clock tonight. Some of these things need immediate attention. But do we keep even the authority of the Department of Health to specify the time? No, they're just supposed to make a recommendation. And then they get to wait for a corrective action plan. And then they have to, within 15 days, decide if the correction plan is adequate. Does that convey a sense of urgency to you? This bill is just embarrassing, given the amount of data that we have, the documentation that we have, the models that we have from other states. We could be doing something real. And instead, this bill proposes that for the next 9 months, we convene some task forces. And during that nine months, if the current rate continues, 18,075 reports of neglect, maltreatment, and abuse will be received. Now, we know not all of them will be substantiated. But that is a shameful legacy for what we will accomplish over the next 19 months or 9 months. And I am really disappointed to not see a bill here that has a sense of urgency. And I'm not on the other committees that heard this, so this is my first hearing, and I am so disappointed that I, as a policymaker, do not have a substantive bill that will, starting in June, as soon as we're done, change the situation for the 88,000 people who will be getting care from others in an industry that I want them to trust and that I want them to feel comfortable with. And I want every person who works in this industry to feel respected and trusted and cared for and feeling like they are in a profession they can be proud of. But we've got a lot of work to do, and I'm sorry, I don't see the urgency here. I'm really disappointed to see that all of that work, all 200 pages of serious analysis, examination of models that have worked elsewhere, is being watered down to some task forces.
Representative Liebling.
Mr. Chair and Representative Kiel, we heard some pretty compelling stories here tonight from some folks about what happened to their loved ones in some of these facilities. And first of all, I want to thank them for hanging around. It's now 10 minutes after 11 if anybody's watching a tape or God help them watching us live stream or listening later.
No, they're sleeping.
But, so people have hung around a long time, and of course, this isn't the first hearing, and the bill has a way to go. But Representative Kiel, we heard some really compelling stuff, and frankly, it makes a person kind of feel sick to sit and listen to some of the stories and to read some of the accounts of what's happened to some of these people's loved ones, and I know you feel that way too, and of course, we all sit here and think that could be my loved one, or it could be me. Could be any of us.
We're all headed there.
We're all headed there one way or another, and you know, you can have an accident and you can need the care sooner rather than later. So this is something that should concern every single Minnesotan in a very personal way. And so I just wanted to ask you, we heard some stories about some pretty bad stuff. For example, we heard some stories about retaliation. We heard about some deceptive marketing. We heard about unfair discharges, number of them. Suddenly, you find that your loved one doesn't have a place to go back to. So I want to ask you, what does your bill do to help the person who's experiencing those problems?
Representative Kiel.
Thank you, Mr. Chair. Well, first of all, and I probably should have written some of the data down already. If you go back into our laws already, some of this is already required. If you're a vulnerable adult, you're required to be served. And there is retaliation law there. Maybe we need to make it a little tougher, but that is in existence. The correction orders that you commented on, Representative Loeffler, were those are for the commissioner to address. But the OHFC has to respond in 30 minutes. The facility has 2 hours to report the infraction, whatever it is, if it's serious or not. And they part of the reason we have the numbers we have are because they are reporting everything. And that makes it hard for the OHFC to get through the weeds of what is serious and what is not. But in my research of talking to facilities, reading the reports, the OHFC was not responding in a very rapid manner, and nursing homes are going to have to, well, not just nursing homes, this is housing with services. They were not reporting back to the person who reported. There was no way to know if the report was heard, addressed, were they investigating. Those things the OHFC has to address. And I believe that we may need to look into some ways of requiring them to respond right away, to maybe not right away, but to let the reporter know soon after that there has been the claim is in process, so that people know that they've been heard. We have to look at some privacy issues there. The challenge is that when I talk to not just providers, but I actually talked to some residents recently while we were on break, and one elderly lady said to me, well, what if I don't want my kids to know what's going on? Why? I don't want them to know, even if it was something serious. Well, you know, sometimes our family isn't stable and doesn't understand they should report, or families should know what's going on so that they can handle it. That becomes a difficult position to let somebody know what's going on. They have privacy, is what I'm saying. And, you know, this is a work in progress, Representative Liebling. It is, like I said, it's not difficult because it hasn't been addressed. We have quite a bit of law. Unfortunately, we have not required and met those laws that are already required, that we haven't addressed those. And there's another bill tomorrow in public safety on some of the civil or the criminal issues, so that part of the bill, so.
So, Mr. Chair, if I
Representative
may. So Representative Kiel, it sounds like your position is that we don't need to change Minnesota's law other than making sure the OHFC can enforce those laws. And, I think a lot of people in this room would strongly, strongly disagree with that position. I think the reality is that this bill that you've brought doesn't have any protection against retaliation. It doesn't have any protection against deceptive marketing, and it doesn't have any protection against unfair discharges, and a lot of other things, too, that have been identified. So the reality is, Representative Kiel, and not, obviously, this is an issue that has some meaning to you, and it should have some meaning to all of us, but we're hearing the wrong bill. I think that's really clear. Your bill is not the bill we should be starting with. There's another bill that, and it is 3468, House Files 3468, which contains the work of the consumers, the people that were here testifying, AARP, and the other groups that have put a lot of time into this, Alzheimer's Association, Elder Voice, Minnesota Elder Justice Center, people that are representing the consumer voice, the people that are experiencing these terrible things in some of the facilities. And, I do want to say, like you've said, like Representative Loeffler said, we understand that there are people also doing good work. We don't want to brush everybody with the same brush. Mm-hmm. But that doesn't mean that we should fail to give needed protection against the facilities or the caregivers or just even the random times when people are not fulfilling their responsibilities, because these are extremely vulnerable people. And we owe it to them to put in place the protections, at least the level of protections that other states have. I mean, it's really shocking that Minnesota is the only state without real public oversight of these facilities. That's really a shocking thing. We're used to being the leaders. So we are hearing the wrong bill. And so when I hear people like Mr. Berg came to the table and said, oh, there are things in the amendment that aren't right. Well, the amendment, one of the amendments that could have been offered tonight is the complete other bill, the bill that's the product, the work product of all the folks that I mentioned. That's the bill we should be working off of. It doesn't mean it's a perfect bill. No bill is perfect when it starts out, but we should be working off of that bill and then hearing in detail in the committee process about what needs to be changed and amending that bill if certain things are left out, just like you're doing a little bit of amending of your bill. So it's not your bill versus perfect, but it's a bill that has the work product of the consumer, representing the consumer voice as the starting point. And it's really disappointing. And it should be disappointing to consumers, to seniors and their families and people with disabilities all over this state, that we're not starting from the point of view that we need to be offering maximum protection and safety. And then we could be hearing from the voices of the industry about what they feel doesn't work, what goes too far, and so on. And then there could be a process where we could amend that bill. And it's just really disappointing to start with your bill, which, not from any lack of interest on your part, I know. And it's certainly not a personal, I know that you are approaching this with all goodwill, but it is really disappointing, not just to me and not just to colleagues on this side of the table, but to a lot of people in this room and a lot of people in this state, that this is where we're going instead of the real work we should be doing. Thanks.
Representative Fisher.
Thank you, Mr. Chair. I, too, want to thank the testifiers for coming forward. I do realize that we've got people, as some of my colleagues have mentioned, we've got some good players out there, we've got some issues out there. You know, when I hear the numbers that were well gone over by Representative Loeffler of over 24,000, that to me is a crisis that demands action, that demands speed. And a work group is not going to get us speed. And I'm not saying that the work group is not needed. I think that's something that can be looked at as we're going forward. But I'm echoing what Representative Liebling was coming off of, is we need to have actions going into place now. I think one of the things that disturbed me most as I was listening to the testimony was the amount of retaliation that's going out there. And I know that the bill that was being referred to, 3468, has a whole section being put in for consumer protection and on addressing the subject of retaliation. I think that is a bill that we should be able to have being heard and brought forward before the session is over. We cannot wait another year and have another almost 24,000 cases come forward. And while that they may not all be proved, I think there's a lot of truth that there could be an understatement in that number when you start realizing that retaliation and these type of efforts that are not counted right now. We've got probably cases that are not being reported. So it's a significant number that cannot afford to wait. And I take a look at it a little bit from a personal side. Within the last few months, my parents have gone into assisted living. My mother has Alzheimer's. You know, when you take a look at the numbers that maybe 1 in 3 may be subject to it, I have concerns. This facility may seem okay right now, but there are occasionally flags that come up. And when I hear the lack of protections out there, I'm worried about my folks in that facility. And as I take a look at not only for my folks, but the other seniors that are out there and the other vulnerable adults out there, we cannot afford to wait. We need to get the other bill going. We need to get it heard so we can get action on it. Thank you.
Thank you, Representative Fisher. Representative Pinto.
Thank you, Mr. Chair. I want to make sure we're really clear on this. So AARP, an organization that has such credibility on this issue that the testifier for the industry actually cited AARP in the point about Minnesota being number 1 or number 2 was an AARP study. AARP, Alzheimer's Association, Elder Voice Family Advocates, and these other groups have said very clearly that this bill will do very little to protect vulnerable adults, which is our goal. No protections against unfair discharges, the other points made. It says has no teeth. It does virtually nothing to strengthen or expand the rights of older Minnesotans living in care facilities. When I'm considering the steps that we need to take to protect older Minnesotans living in care facilities, I'm going to be looking to the AARP of Minnesota and these other groups. I will be much less likely to look to, we heard from the industry on the one side. I haven't heard much else beyond that. I, too, do not doubt at all Representative Kiel's intentions here and her goodwill. But this bill, according to the people who have expertise, who we all look to help us make the decision to protect our elders, they are saying that this bill does not do it, and it does not address the epidemic. I don't know about the rest of you, but I got this long list of allegations about care facilities in my district and our districts put together by Elder Voice Family Advocates painstakingly. I'm going to be looking to them to decide what we should do. This bill does virtually nothing. This should not move forward. We should move forward on a bill that actually will do something. Thank you, Mr. Chair.
All right, Representative Murphy.
Thanks, Mr. Chair. And Representative Kiel, for the testifiers that came and testified about their loved ones, did all of those happen, all of those cases happen in Minnesota?
Representative Kiel.
Mr. Chair, I'm Representative Murphy. I believe so, yes.
So they were all Minnesota experiences, all Minnesotans who were injured or perished in facilities here in Minnesota.
That's my understanding.
And that when, Mr. Chair and Representative Kiel, when was that? So it was the last summer the story came out. Is that correct?
Representative Kiel.
The news releases were in November of 2017.
Yeah, thank you. And Mr. Chair and Representative Kiel, what is the timeline for the bill that we have in front of us? So if this becomes law and the work groups are convened, What is the next step after the work groups are convened?
Representative Kiel.
Mr. Chair and Representative Murphy, my intent is, or the intent of the bill is to have those decisions made that need to be handled hopefully by January when the new legislature convenes, so that those licensure, that the other issues that need to be addressed are the legislature's looking at it in January, end of January. So my intent would be that by 2018 things, or 2000, this is 18, isn't it? 2019, that the legislature has in place a licensure for assisted living, housing with services, some direction for those facilities so that they're able to. It was needed, according to the OLA, it is needed in many fronts. The OHFC needs the licensure more clear. Assisted livings, housing with services, they're making comments that there needs to be a clear direction. And I think that will help us to recognize where we should put our family members, or where our family members should make that choice also.
And thank you. And Mr. Chair, so if I understand that, just in the rough math, it'll be a couple of years of work before we put into place meaningful law change with regard to elder abuse in the state of Minnesota.
Representative Kiel.
If someone is waits that long, but what I'm hearing, in fact, when I was at my local nursing home this last week, they've already told me what they're planning on doing. And they're addressing some of this already, whatever they can. Part of the challenge is the facilities have asked the MDH to also for recommendations when they make reports. You know, what's happening? What should we be addressing? What are the statistics? They weren't seeing or hearing any of that either. So it was hard for them to read what needed to be done in some cases. And in some cases, I don't know if we have testifiers here today, but part of the problem is that they did make changes, but probably because of human error, or laws weren't defined enough so that they could arrest somebody or not put them back in the service. We're seeing staff go from place to place, and that's really serious. And we need to be able to identify that and handle that, making sure that somebody who's committed a crime, especially, is addressed right away, as soon as we can.
And thank you, Mr. Chair and Representative Kiel. You know, a long time ago, I worked on the Vulnerable Adult Act, and I have to imagine that given what we know from the news stories, from the OLA report, from the testimony that we've heard, that we should be able to act more quickly than 24 months in bringing relief for our cherished elders and the care that they're receiving in care facilities. And I heard the testimony from the woman that joined you at the start of this hearing, and her frustration that there were some that were excluded from the governor's task force, and arguing that we should move forward with another group of studies because we want to make sure that those voices are heard. And this legislative process is really about voices being heard. So we could have been moving on the consumer-oriented bill and then incorporated the concerns and voices of the industry, and come out of the session with something that would have brought relief. And I just, think that 24 months is a very, very long time. And I understand this is complicated, like most things that come before us. But when I think about another significant incident in Minnesota and our response, when we think about the collapse of the 35W bridge, which happened in August, and by September of the next year, that bridge was replaced. There had been an act of Congress, there had been an act of the legislature, an override, there had been an act of this legislature and funding, and a bridge was built. A big bridge was rebuilt because Minnesotans said that should not happen. That bridge should not collapse. And I know that Minnesotans are deeply disturbed by what they read about what's happening in care facilities across the state of Minnesota. And those stories and what we heard tonight warrant more than study. It requires action. And we should be able to act more quickly than 24 months. And so I hope that you will take into consideration the work that was done by that task force, and we start to bring actual relief and not just study. We've only got 6 weeks left.
All right, Representative Schultz.
Thank you, Mr. Chair. So in the medical field, medical providers take the Hippocratic oath to do no harm, to provide the best care to the best of their ability to patients. And as elected officials, I think it is our duty and our job to do the best we can, not to harm people living in Minnesota, to help people in Minnesota. And by not bringing forward the bill that was worked on by all of the groups that are advocating for patients and for loved ones, that we are doing harm by not taking action as soon as possible. And I think that a bill that was produced from the task force needs to come to committee and get right to the floor so we can start addressing the problem that people are being harmed in our state. And any delay is our responsibility. And so I hope you would reconsider and work with your Republican Senate colleagues, because their bills are doing a lot more than this bill. And if we do nothing or we delay, we are responsible for the harm that's being done to people in Minnesota.
All right. Other member comments? Final comment, Representative Kiel.
I thank you, Mr. Chair, members. I wanted to point out, we talked earlier about retaliation. It is in the bill. It's on page 18 and 19. Some of it is existing language. Most of it is, but there's some added references there. There is, I guess, I know we need to get going. We're tired and this has been long, but I want to impress on everybody who bothered, that is staying and taking the time. And for members that don't know me very well, and I talk a lot, so you probably all have heard this, but for me, this is personally important. I have spent my life taking care of people. I don't believe that we're worse than other states. I have been shopping in other states for people to reside in nursing homes. I distinctly remember walking into one and my husband said, we're going. We're not even talking. It was so pathetic, and we were helping to find a place for his aunt. She was wealthy enough, we flew her home to Minnesota. That was her choice, in a private jet. We were able to give her the quality of care in Minnesota that she deserved. And we knew when we brought her home, she would have less than a year to live. But that's not the only one. I've had experiences with assisted livings. My aunt last year died in March. She fell out of bed 3 months before. There was some major problems with what happened. She's handicapped. She's mentally handicapped. She had all kinds of challenges. Lived in a nursing home for 20 years, which is very unusual these days, memory care toward the end. And I think this is an urgent issue. But I also know from my experiences that if we are not very careful with what we do to make sure that we are providing the best care for everyone and giving the guidance to the facilities that are going to care for them, that there are going to be some problems, and we are going to lose some facilities. I was in a funeral last week, and I had more than one nurse. Granted, they're getting closer to retirement, but they came to me and they said, Deb, no more. I quit. I put in my notice. I won't stand for any more. I work hard. I dedicate extra time. And they said they were really frustrated. And I know they do really good work. But I also know they're on this report that I got from Elder Voice. And in fact, they told me about some of these reports, unsubstantiated. I find it ironic that I saw it in here, but shared with me a couple of them. And they were reports that, and I don't want to minimize anything that has happened to anybody, but there were some unsubstantiated reports that they lost, the resident lost something, their personal item, and they looked everywhere for it. And after 2 hours, they had to call and report it. So they did. And after they reported it, the next day, guess what? They found it. So they called back and they said, you can take that off the report. We found it. Oh, no, it's part of the report. That's the way it works. So of those 24,000 reports, which are horrendous by any means, to have that many reports, we certainly need to close down the reports. Lower them. We have to understand that there's a lot of reporting done here that isn't the tragic stories we're hearing. And so we have to get down to making sure we're taking care of the individuals that are in facilities. And you also need to remember, I asked the department, we don't have that number yet, but this can be people that have services at home. This can be challenges between family members. This can be challenges between residents within housing with services. There's all kinds of reports that are made. So that's why I asked them, what is the breakdown? What is the details? But we certainly need to do as much as we can as soon as we can. With that, Mr. Chair, I would ask for support of this bill.
Thanks. I'll renew the motion that 3455 as amended, or 3308 as amended is laid over. Thank you, Representative Kiel, for the work on the bill and also for your good work in the committee. Next up, we have House File 3640, Representative Albright. Representative Albright moves House File 3640 to be laid over. There are no amendments. We have the bill before us. Representative Albright, to your bill.
Thank you, Mr. Chair and members. This bill updates provisions governing background checks conducted by health-related licensing boards and the procedures related to temporary suspensions for actions that present an imminent risk of serious harm. I have two testifiers ready to answer questions pursuant to the provisions of the bill if requested by the members.
Thank you, Representative Albright. The bill is before us. Is there any member questions to the bill? Anybody from the audience want to testify on House File 3640? Seeing none. Final word, Representative Albright.
Thanks.
House File 3640 is laid over. Representative Backer, House File 3134. Representative Backer moves House File 3134 to be laid over. We have the bill before us. There's an A2 amendment. This is an author's amendment. Representative Backer moves the A2 amendment. Representative Backer to the A2 amendment in the underlying bill.
On the A2 amendment, we just add dates that need to be corrected. Also, Chair, we have a A3 was posted, but it did not get printed out. A need to do an oral amendment, 1.4, changing page 2, line 24, delete June 30th, and insert January 15th.
That's fine. We will incorporate that.
Thank you. Thank you, Chair.
All right.
And that is being passed out, members also.
Yep. That's just the clarification.
Yep. So just if we can move to put that in and we
All
can
right.
speak to the whole bill, that'd be great, Chair.
We can, all right, all those in favor of adoption of the amendment, please say aye.
Aye.
Opposed, no. The amendment is adopted. Representative Backer, to your bill.
What this bill does is the federal government has informed us that they were stopping Medicaid payments to children's residential treatment programs. And then what this program does is it extends it until from May 1st, 2019 to June 30th, 2019. And then it also changes the report date from June 30th to July 15th. So it just makes it work better for that program. And that's what this bill does. And I have a testifier that will speak on it briefly.
Welcome to the committee. Please introduce yourself for the record and give us your testimony.
Mr. Chairman, committee members, my name is Jamie Halpern. I'm an area manager in Hennepin County's Human Services Department, and I'm testifying today on behalf of MACSA, Minnesota Association of County Social Service Administrators. We support this bill as amended. The extension that's contained in this bill gives the state of Minnesota extra time to address the loss of federal Medicaid reimbursement for Minnesota's children's residential treatment programs. Without a correction, this loss will eventually result in almost $5 million a year of additional costs transferred to counties. This could result in the elimination of essential mental health treatment programs and services for children and youth in our state with serious mental health needs, including these residential treatment programs and community-based care that can prevent the need for such treatment services. So on behalf of children with mental health needs in Minnesota's counties, we urge your support for this proposal.
Thank you.
Okay.
There-
I think we have one more? Okay, here.
All right, welcome to the committee. Please introduce yourself for the record and proceed with the testimony.
Hello, my name is Sam Smith. I'm the Public Policy Coordinator for NAMI Minnesota, and I'll speak briefly to why we pushed the report date to January 15th. This is an extensive report thinking through the full continuum of children's residential care and including regional listening sessions and extensive stakeholder engagement. Pushing back the report will allow us to give a finished product to the legislature. Thank you very much.
All right. Is there anyone else that would like to testify on this bill? Seeing none. Member questions? Seeing none, final word, Representative Backer.
Thank you, members.
With that, House File 3134 as amended is laid over. Thank you, Representative Backer, and thank you, testifiers. Once again, sorry about the late hour. Representative Schomacker moves House File 3823 to be held over. Representative Schomacker to House File 3823.
Thank you, Mr. Chair and members. House File 3823 establishes a working group that is independent of and different from the types of working groups that we typically see. The focus is pretty typical of what we see, and that's trying to lower the cost of health care and identify some of the key triggers for what keeps the cost of health care up. What's different about this one is that it's an independent group, and you can read through the bill and see the types of people who are included in this and the types of people who are being appointed to and who are doing the appointing. What we want to do is try to get this conversation outside of the Capitol bubble, outside of the people who sit on the two sides of us in the committee room each week, and have it be data-driven and not agenda-driven for what they're trying to do here. And so we have Bentley Graves from the chamber here to answer any questions if there are any, and it is my intent to take the two amendments that were offered if that helps in the process. I do have some comments on the A6, but that is my intent, Mr. Chair, and thank you.
Okay, Representative Schomacker, there's two amendments in member packets, the A4 and the A6. They're offered by Democrat members. Would you like to go through those now? Or
Yes.
would you like to do testifiers? Amendments?
Right now,
All right.
Mr. Chair.
Let's do the A4 amendment. Who'd like to offer the A4 amendment? Representative Liebling offers the A4 amendment.
Thank you,
Representative
Mr. Chair. Right, well, I won't belabor this, but hey, there's no time to talk about health policy like 11:45, right?
That's when I do it best, Madam Chair.
I know, me too, me too. Oh,
You lie.
Flashback, sorry.
well, the middle of the night, and who knows what can happen, right? Anyway, I just thought that if we're going to be doing this kind of a, task force, that we should be, well, I think Representative Schomacker, you just said you want a data-driven and not agenda-driven group. And of course, when you have the chamber, coming in and bringing it, I would say that you're not exactly assured of that. So I wanted to just add here that we should be evaluating all available alternatives for promoting access to health care for all Minnesotans. So I think that was kind of to me, just a big gap, and I'm glad to hear that you're interested in adding that to the bill.
All right, all those in favor of adoption of the A4 amendment, please say aye.
Aye.
Opposed, no. The A4 amendment is adopted. The A6 amendment, who'd like to offer the A6?
That's mine also, Mr.
Representative
Chair.
Liebling offers the A6 amendment. Representative Liebling, to your amendment.
Thank you, Mr. Chair, and I just thought if we're looking to make comparisons with cost and see how other states are doing, that we ought to also be looking at other countries. Make sure that we're looking at other states and other countries, because other places do it differently. And if we're not being agenda-driven, I think we should fairly look around the world and certainly look at other states to see if other people have ideas that we might, or to see if they're getting better results, to see if they've got lower costs, to see if there are other ways to organize our healthcare system that we might actually be able to model ourselves after. So that was the intention.
And Mr. Chair.
Representative Schomacker.
Thank you, Mr. Chair, and it is my intention to adopt it. I just wanted to get a couple of thoughts on the record on this one. I think that there's a little bit more work we can do on this one. We understand the point, want to get to that point and have that addressed. The idea with the group, as it was coming forward, is that we'd be comparing to other states, just because they have similar types of healthcare systems. Obviously, you're looking to expand that. There is some concern about the possibility of having limited bandwidth for the group to do its work with that, but we can work through some of those points and just what, on the comparison scale, just how that would actually work if it's not of a similar type of model. Just is the intention on the commercial, if they don't have a commercial market, for instance, do they have to rework that entire process or re-engineer the simulations of what that country would look like? But I'd like to adopt it so we have the language to work on, but then continue working on that to kind of clarify those points and move it forward.
So you're in favor of that amendment, Representative Schomacker?
He said that, Mr. Chair.
Okay. Then he didn't sound like it, though.
It sounded like it to me.
All
And
right.
I want to officially move the amendment, by the way.
All right, Representative Liebling. All those in favor of adoption of the A6 amendment, please say aye.
Aye.
Those opposed, no. The amendment is adopted. All right,
Must be a good one.
It is.
all right.
Voted for it. Catch that favor from you.
Representative Schomacker, to your bill as amended. Oh, does anyone in the audience want to testify on behalf of this bill? All right, seeing none, final discussion, members. Representative Pinto.
Thank you, Mr. Chair. I just want to know, is there do we have a cost, a fiscal note on the bill? I noticed that there's the blank appropriation, but figure there's probably would be a specific cost for
Mr.
it.
Berg.
Mr. Chairman, Representative Pinto, there is a fiscal note request. There's a preliminary note, but we've had a little issue with this. It was initially referred out to, I believe, just the legislature, and then it's steadily several agencies have been added to it as they realize what's on it. It's now referred out to 5 agencies, 2 of which have not responded. Probably the bulk of the costs are in there at the legislature is going to operate it. It's got 176,000 in 19 and about a little over 400,000 in each year thereafter, currently.
All right, Representative Schultz.
Thank you, Mr. Chair. So I served on the Healthcare Finance Task Force. That was composed of, I think, 29 members representing different industries in the healthcare field. We had healthcare economists and health policy individuals represented from different organizations outside the legislature. We came up with a very comprehensive report. And a lot of the things, the duties that this commission would address, a lot of that information is already available from our great research staff at the University of Minnesota and other higher ed institutions in the state. And I don't know why we would be spending money to duplicate things we already have, that we're funding the University of Minnesota already to do some of these things. So I'm kind of confused as why we want to spend money and duplicate things information we can already ask the University of Minnesota to provide to us and other organizations like SHADAC that have the expertise to give us the information we need.
Representative Schomacker, why are we doing this?
Thank you, Mr. Chair. We want to have something that is continuing beyond just what we have with the governor's task force on this, and we really wanted to get it outside of the influences of the Capitol building, what we have with that. And so we wanted to have the recommendations come that way, and it's always good to have as much information as we can.
Representative Schultz.
Thank you. So we should spend money to convene this commission, or could we just not, have the University of Minnesota, our experts that are not partisan, come and give us information that they already collect and monitor these many different duties that you'd want the commission to conduct?
Representative Schomacker.
Thank you, Mr. Chair. Representative Schultz, the purpose of the commission is to work on improving the healthcare and outcomes and to lower the cost on the commercial market piece. And so spending a little bit of money to be able to identify ways that we can reduce and understand the outcomes from the commercial market is a good interest.
Yes, Mr. Chair, I agree that we would like to act. My point is that we already have a lot of this information that's collected every year, and we have good reports and academic studies that we can base our policy decisions on, and we should just use that information and not duplicate things or spend money twice to get information. So I don't see the point of putting together this commission when we can use services that we've already spent money on to give us the best information we can. I just don't understand why we would want to waste time to put a commission together when a lot of this information is out there already, and we need to act on the information that's out there.
All right, further discussion. Final word, Representative Schomacker.
Nope.
All right. Representative Schomacker renews his motion. House File 3823, as amended, is laid over. Our next meeting is tomorrow. We will have 7 bills on the agenda, and I would like to complete the 7 bills during the time of the committee so that we don't have to come back on Thursday night. I think the bills should move pretty rapidly for tomorrow. So Apologize to everybody who had come and had to wait. Sorry about the delay in time. Again, appreciate the indulgence of the members, especially the DFL staff, and for the members helping us out with the amendments and
Do you want to ride home tonight?
getting some folks shuffled around to get testifiers in and out. So we do appreciate that. With that, members, we are adjourned.